How about from Yongsing's side?
I think it's all right.
Okay.
Okay. Just Rima, make sure your hair doesn't block your mic lah, huh?
Yes, my mic is at the bottom.
Awesome. And you guys can wait first lah.
Can everyone hear me?
Yes.
Yes.
Okay. Is it clear though?
Yes.
Okay, awesome. That's all. Good morning, everyone. I hope
Good
you guys
morning.
had a good sleep and a good rest. And yeah, let's do this. Good luck, everyone.
Thank you.
Thank you.
Hello. Sanjita and Rima, the stage is yours. So enjoy the stage and have fun when you are presenting or talking. Just like enjoy sharing whatever that you are prepared to share. And thank you everyone for being here. So anything, just text and enjoy the event today.
Thank you, Yongsing.
Thank you.
Thank you, guys.
好，不是铁。
Good morning, everyone, and welcome. We are delighted to have you in our World Mental Health Awareness Day, Bridging the Gap Mini Symposium 2021. Hope all of you all had a good night's sleep yesterday and a warm breakfast this morning. I am Rima, and this is Sanjida, your MCs for this event. We are clinical psychologist trainees enrolled in the Master of Clinical Psychology program at the University of Cyberjaya. Before we get started, we would like to introduce a few housekeeping rules to ensure a smooth flow of events. Firstly, kindly keep yourselves muted throughout the event. If there are any questions, you may use the chat box to convey any queries you have. Please communicate professionally, be respectful and courteous at all times. Do note that we are only able to attend to topics related questions. Any personal questions will not be attended to.
Please join in 5 minutes early for each virtual session. We encourage you to interact with the speaker during the webinar by turning on your camera for better interaction. In case you are cut off because of a poor connection, you can access through the same mini symposium link that is provided. This mini symposium will be streamed live on YouTube and will be accessible for replay within 24 hours. And lastly, we would highly appreciate your active participation in each session. So do sit back and have fun. Now, a very good morning to Prof. Dato Dr. Muhammad Abdul Razak, Vice Chancellor of University of Cyberjaya, Professor Dr. Nasaruddin Abdul Aziz, Dean of the Faculty of Allied Health Sciences, Associate Professor Muhammad Saidi Haji Ismail, Director of Tabung Amana Zakat University of Cyberjaya, esteemed advisors and program coordinators, respected lecturers and staff of the University of Cyberjaya, dedicated members of the organizing committee, and last but not least, our dearest attendees, ladies and gentlemen, welcome to the 2021 Mental Health Awareness Day, Bridging the Gap Mini Symposium. This event is organized by UOC Psychic Club in collaboration with Master of Clinical Psychology students and the Peer Wellness Club. We would like to extend our heartfelt appreciation to our main sponsor, Tabung Amana Zakat UOC, who had generously contributed to the success of this event. We would like to thank all the individuals who are willing to spend their time with us here today, as this event not Sorry for the technical difficulties.
As the theme of this year's World Mental Health Day is Mental Health in an Unequal World, this mini symposium is mainly organized to educate the public on the inequalities in access to mental health services and the strategies that could be taken to bridge the gap. Also, the workshops in this mini symposium aims to provide low cost as well as effective techniques on how to maintain and improve one's mental health during the pandemic. Before we move on to agenda of today's event, we would like to ask for your favor in sharing this event on Instagram or any other social media platform. If you are sharing on Instagram, please tag uoc-psyche.official and share this event with your friends, so there are more people joining this event.
That's right. Our mini symposium will begin with 3 mini workshops from 9:30 to 10:30 a.m., all of which will be conducted by clinical psychologist trainee from the University of Cyberjaya. Following that, Ms. Anum Sophia, a clinical psychologist from ThriveWell, will deliver the first webinar on the topic of mental health services for the underprivileged. At 11:45, there will be the first announcement of the winner for the Instagram Reels competition. After that, there will be a lunch break from 12 to 12:55 p.m. and we shall resume with a workshop on how to support someone in need. Furthermore, there will be a second announcement of the winner for the Instagram Reels competition. Then Ms. Madiha Fuad, the creator of Plus Vibes, will conduct the second webinar at 15 p.m. with the topic Pandemic and the Access to Mental Health Services. Finally, at 3:30, we'll conclude this mini symposium with a closing ceremony. Kindly refer to the agenda that is posted on the Psyche Club Instagram page or on the agenda that has been emailed to you for further clarity of the event schedule.
Now, I would like to call upon the Director of Psyche Mental Health Month, Ms. Chut Putri Noor Atika, to deliver her welcoming speech.
Thank you, dearest MCs. Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And a very good morning to Professor Dr. Muhammad Abdul Razak, Vice Chancellor of University of Cyberjaya, Professor Dr. Nasaruddin Abdul Aziz, Dean of the Faculty of Allied Health Sciences, Associate Professor Muhammad Saidi Haji Ismail, Director of Tabung Amanah Zakat, University of Cyberjaya, esteemed advisors and program coordinators, respected lecturers and staffs of University of Cyberjaya, dedicated members of Psyche Mental Health Month Organizing Committee, and last but not least, ladies and gentlemen, attendees of the 2021 Mental Health Awareness Day Bridging the Gap Mini Symposium. I am Chut Putri Noor Atika, Director of Psyche Mental Health Month. Allow me to begin by saying that it is an honor for me to address this distinguished gathering on behalf of the Planning Committee and to express gratitude to all of those present today for being here on this delightful Sunday morning. I would like to extend a special welcome to Professor Dr. Muhammad Abdul Razak, our esteemed Vice Chancellor, who will be officiating this event in a short while. Thank you very much, Professor, for always making time for student events, even on a weekend when you should be resting. We are so excited to have all of you here today to participate in our event. Despite the many events conducted in honor of World Mental Health Day today, we are glad that you have chosen ours to participate in. I would like to also take this opportunity to express my immense gratitude to the driving force of this project, my dedicated and enthusiastic Psyche Planning Committee members. No words can describe how thankful I am of this team for having faith in me and for allowing me to lead such a huge project. Your commitment and efficiency in the last 3 months have inspired me to constantly improve myself as a leader, a team member, and a person. As mentioned by the MCs, this project is a collaborative effort between Psyche Club, students of Masters in Clinical Psychology program, as well as the UOC Peer Wellness Club. For the first time this year, we also recruited volunteers from among UOC students from across the faculties. It has been an honor for the Psyche Club to be working closely with these various parties for this year's World Mental Health Day celebration. I am beyond grateful that we have taken this opportunity to learn as much as we can from each other while supporting each other's growth. Our utmost gratitude should also be extended to Tabung Amanah Zakat of UOC for contributing a great deal to the success of this event and for believing in us, the organizing committee. Ladies and gentlemen, this mini symposium serves as a grand launching for our Psyche Mental Health Month, a series of events curated by the Psyche Club to celebrate World Mental Health Month this year. As part of our ongoing commitment to the community's mental health and well-being, we have curated this series of events to educate ourselves and the public, as well as to encourage discussions on the theme of this year's World Mental Health Day, which is Mental Health in an Unequal World. This project is in line with the United Nations Sustainable Developmental Goals, which are good health and well-being, quality education, reduce inequalities, and partnership for the goals. As a future mental health professional myself, I could not stress enough on the importance of starting conversations, whether informal or formal, about mental health and psychological well-being to increase the awareness as well as to reduce.
I think there is a.
Can I continue? As well as to reduce the stigma or taboo that latches onto the subject. Mental health awareness goes beyond understanding the different types of mental disorders and their symptoms or etiology. It also has to do with being well informed about the treatment services provided and the types of support that the community can provide to promote and maintain mental well-being. For that, we bring to you a series of events throughout the month of October in hopes that it would inspire ideas and discussions around the ways that we can make mental health services more accessible in our country from wherever we stand. Therefore, following this mini symposium, we'll be having our Psyche Discord Campfire, a more casual get-together where participants can engage and in a more carefree setting, while still sharing experiences and insights on our theme. Lastly, we shall wrap up this month with Psyche Coffee Shop, an Instagram event in which we would open a channel for you to send anonymous messages for your loved ones who might be struggling with their mental health. We hope that you would stay tuned for both of our succeeding events in the weeks to come. In the meantime, you can connect with us on our social media platforms, especially Instagram and Discord, to stay updated. Finally, I certainly hope that you will all find this program beneficial for you. And at the end of this mini symposium, we hope that you could provide us your earnest feedback so we could create better events and programs for you in the future. That is all from me, Cik Putri Nur Atika, Director of Psyche Mental Health Month. Thank you and Assalamualaikum.
Thank you, Ms. Chit Putri, for the wonderful welcoming speech. Without further ado, and with much honor, I would like to call upon Yang Berbahagia, Prof. Dato Dr. Muhammad Abdul Razak, the Vice Chancellor of the University of Cyberjaya, to give his speech, as well as to officiate the 2021 Mental Health Awareness Day, Bridging the Gap Mini Symposium.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi ta'ala wabarakatuh. And a very good morning. Thank you very much, Madam Chairperson, Yang Berbahagia, Professor Dr. the Dean of Allied Health Sciences, Yang Berbahagia, Professor Saidi, from our Zakat, and all the professors, the lecturers of Faculty of Psychology and Allied Health Sciences, Yang Berbahagia, the Honorables Chut Putri as a chairpersons of this occasion, all the members of Psychic Club of UOC, and all the participants of this great occasion of mental health activity. Salam sejahtera to all of you, and welcome to this mini symposium, which is related to mental health, which follow with workshop and other beneficial activity. First and foremost, I'd like to welcome everybody, and at the same time, I'd like to congratulate on behalf of the university to Psychic Club and also all the members, especially from clinical psychologist group, and of course, psychology department for having this important occasion for not only to our students, but the society. As we know, mental health play important role in our day-to-day life. Our lives are connected to each other. And one of the important connector is, of course, the well-being of our mental health, has been stressed by Putri just now. Yeah. Mental health is become more important in this complexity of the world. And people now aware how important it is in order to become or to achieve peace in life, not only to ourselves, but for the whole world. And obviously, in order to succeed that, we have to close the gap, as been mentioned, and the main theme of mental health work, this year, which is inequality or uneven distribution. As we all know, our university have given and shown the importance of your program. Psychology program, it soon will become faculty on your own. So as well as the importance of connecting to the people through the program of clinical psychologists. Now, I think the faculty is one of the main dominant of the faculty in this university, with big number of students, big number of reception that shown that the parent, the student now aware how important the psychological aspect of life. Yeah. And as we know that mental health not only affected to certain group of people, they can be started from children and the youngsters, and of course, people like me, adulthood. As well as we are living person, we always have a challenge in mental health. And we always want to achieve the stable, the healthy mental health in our lifetime in order to achieve or to receive the successful future life. So the present life is very much too materialistic, as we know. So the success of the life is being measured through how much you make materially. Yeah, the rich you are, the better you are. In which obviously now we know it is not true. Yeah, not happy, not necessary. The rich people is the happiest people, in the world. Studies has been done. Yeah, it shows that certain country in which probably very poor. Yeah, I take example of Bhutan. Bhutan is very small country. The population is probably around 1 million. They don't have natural resources. Yeah, but the people living happily. Yeah, and this kingdom, which is in the middle of Malaya, they actually lead by royalties, by the king, and people refuse to change the king. People want to maintain the system because although they are poor compared with other successful countries, but the so-called happiness score are very high, among the highest in the world. So life is such a way that it's not 100% depend on how much you have and how much you gain, materially, but to look into how stable your mental health, how successful are you in dealing with day-to-day mental health problem. Obviously, in this pandemic session, pandemic era of COVID-19, the problem of mental health become much more worse. I've got a friend which is the head of Department of Pediatric Psychiatry in Hospital Kuala Lumpur. And from his experience recently that related to COVID-19, they got more and more patients coming to the hospital, in variety of cases that related mainly to the mental health instability or mental health problem. So it is really timely for the club and of course the program of clinical psychologists to organize this meeting, to benefit everybody, to our students, as well as to the public. So I wish you good luck. I wish you the successful, the so-called mini symposium, and we will support all this activity that done by our beloved student. And hopefully in future, we can have a bigger symposium that related to mental health. Probably we can organize one international symposium. As you know that every year we have, or every other year we will have the National Psychology Conference we do with University Malaysia Sabah with support of Professor Rosna and the team. So hopefully with the strength of our clinical psychology department or program, we can have international meeting that related to the mental health for everybody. With this, with lafaz Bismillahirrahmanirrahim, in the name of great Allah Subhanahu wa Ta'ala, I sincerely open your mini symposium on mental health that related to uneven, in the practice of mental health. Thank you very much. Congratulations again to Chut Putri and the team. We have done an excellent work, excellent preparation. Thank you to the faculty, Prof. Nasa, for giving them the support, and of course to my good friend, Professor Saidi from Zakat, who always come forward to help the student to have this kind of activity for benefit of everybody. Sekian, wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh, and have a good day. Thank you.
Thank you, sir, for officiating our event with such a meaningful speech. We truly hope everyone will be able to benefit from our event.
Now, to kickstart our day, allow me to introduce our 3 mini workshops for those who may not have decided on which one to join. Workshop 1, Relaxation Techniques, conducted by Ms. Rima, who is also our MC, will demonstrate all about the relaxation techniques, which include deep breathing, progressive muscle relaxation, and also how to apply them in your daily life. Workshop 2, Communication Skills, will be about how you could assert your ideas and communicate in a more effective manner that will be conducted by Mr. Joshua. Workshop 3, Time Management, will teach us how to juggle multiple tasks in life, as Ms. Charlene will introduce ways to manage your valuable time. After the workshop, please join us back in the Zoom meeting, as we will have a webinar on mental health services for the underprivileged. As you can see here on the screen, there are 3 QR codes that will lead you to the Zoom meeting room for the workshop that you are interested in. We have also posted the Zoom links in the chat. If the QR codes or links are not working, please let us know in the chat box or raise your hands. We hope that all of you had a fun and fruitful experience from the workshop and learn how to practice useful techniques in your daily life. Just a soft reminder, you can see the link in the screen. Also, we have posted the Zoom links in the chat. If the QR or links are not working, please let us know in the chat box or raise your hands. Reminder for the participants, you can see the link in the screen. You can also click the link posted in the chat, and please do let us know if the QR codes are not working. You can also raise your hands. For those who are still joining our mini symposium, you can see on the screen there are 3 QR codes given that will lead you to the Zoom meeting room for the workshop that you are interested in. We have also posted the Zoom links in the chat. If the QR codes or links are not working, please let us know in the chat box or raise your hands. Participants, those who are still joining our mini symposium, please, you can see here on the screen that there are 3 QR codes given that will take you to the Zoom meeting room for the workshop that you're interested in. We have also posted the Zoom links in the chat. If the QR codes or links are not working, please let us know in the chat or raise your hand. Thank you. Participants, those who are still joining our mini symposium, as you can see here on the screen, there are 3 QR codes that will lead you to the Zoom meeting room for the workshop that you're interested in. We have also posted the Zoom links in the chat. If the QR codes or links are not working, please let us know in the chat box or raise your hand. Thank you. dear participants, as you can see here on the screen, there are 3 QR codes that will lead you to the workshop that you are interested in. We have also posted the Zoom links in the chat. If the QR codes or the links are not working, please let us know in the chat box or raise your hand. Thank you. Hope you enjoy the workshop.
Logistic, can you send?
Dear participants, you all are in the workshop already. Have a nice time. If anyone is still waiting to join the workshop, please check the QR codes given on the screen. Also, we have posted the QR codes in the chat. If the QR codes are not working, please let us know or raise your hand. Thank you. Good morning, Miss Anna.
Good morning.
Miss Anam, if
Is my mic working correctly? Can you hear me?
it's work. Yes, I can hear you.
Okay, thank you. Just
Thank you,
checking.
Miss. Yes, sure.
Hi, so Sanjida, should I call you Sanjida?
Yes, you can call me Sanjida.
Okay, so this is going to start at 10:30, right?
Yes, Miss. We are going to announce first, and then we'll start at 10:30.
Okay. Well, just a heads up, right? I just got gone down with the flu last night.
Oh,
Yeah,
sorry to hear.
yeah. So my voice might not be as crisp and clear I would like to, but well, we see. Oops.
Yes, sure. We will give a heads up before we start.
But it's okay. I can just introduce myself, and during that time I can just explain.
Are you feeling well now, Miss Han?
Well, I'm a little bit drugged, basically. So yeah, but I think it would be fine. But I do need to sometimes cough, I guess. Like I do excuse myself. I need to excuse myself.
Yes, sure, Miss.
Yeah. So this is the Psyche Club program, is it? It's like a degree students committee, isn't it?
Yes, it's a collaboration with master students and degree student psyche club.
Okay. Right. Okay. Because I also see like names with the MCP. So Sanjida, you're with the MCP. What's that stands for?
It stands for Master of Clinical Psychology students.
I see. Excuse me. Yeah, okay.
Yes.
Yes, thank you, Lim Yong Zin, Master in Clinical Psychology. I just saw the chat box there. So the slides, it will be presented by from your side, right? Is that correct?
Yes, Miss Anam. It will be presented from our side.
Okay, thank you. Right, so because I usually would like to see, the chat sometimes if I were to ask question, or yeah, and how would the question be, the question and answer, right? How would that be handled? Would it be like they can ask question during the talk, or?
At the end of your webinar, we will open the floor for Q&A for 10 minutes. And be the MC, we will pass the question to you.
Okay. Will you be collecting questions during the talk as well?
Yes.
Okay. Yeah. Yeah, hopefully
We are
my
just
voice work. Yeah?
Yeah, sure, Miss. Yeah, your voice.
Yeah, no, I say that hopefully my voice works today. It's okay, you can go.
Yes, Miss Anum, don't worry. Your voice sounds perfectly fine now.
For now. Hopefully, right?
Miss Anum, we are actually waiting for the participants to get back, and then we will start exactly at 10:30.
Okay, sure. Psyche is a committee of both bachelor and diploma students. Ah, I see.
Yes.
Welcome back, everyone, to our mini symposium. We hope you enjoyed the mini workshops. Without further ado, let us move on to our very first webinar for today on mental health services for the underprivileged by Ms. Anum Sophia. Ms. Anum Sophia is a clinical psychologist from Thrivel, a social enterprise that aims to provide accessible mental health services to everyone, especially the underprivileged communities. Ms. Anum Sophia graduated with a master's in clinical psychology from UKM and a bachelor of psychology from UPSI. She has had experience working with various different adult and children populations from her time with HUKM, Genius Kurnia, and the Kedah Contingent Headquarters. Currently, she is the representative for Jom Sembang, a project under Thrivel that intends to provide accessible mental health and psychosocial support to financially impoverished communities. Let me warmly invite Ms. Anum Sophia to share her insights in this webinar.
Hello, everyone. Hope you're having a nice day. Before we start, I'm just going to give a heads up, right? I'm suffering from the flu just last night, right? So if I cough in the middle, I do need to apologize first. And also, I guess if I sound drugged, I most probably am. But it's not illegal, right? Like, it's not illegal drug, so it's okay. Okay, so I guess we can start with the slides. Let's just share the slides first. Okay, right. So the topic that I think we're going to be discussing today is reaching out to the underserved. I'm drugged again. So this topic is actually quite a special topic for me because, you know, coming from ThriveWell, we do work with a lot of underprivileged communities and, you know, minorities, for example. So
I'm sorry, Miss Anu, to interrupt, but the mic was muted, Miss.
yeah, how long has it been muted?
Just now.
Okay, right. Okay. So yeah, without further ado, I think like before we start our conversation, I would like to tell you a story. I like story times, right? So the story is this. Once upon a time, there is a orthopedic, a bone doctor, right? A doctor who fix bones and joints, right? And this doctor is very, very famous in his work. So he has almost like 20 years experience. He's a specialist, he's a surgeon, and he worked at the top rated hospitals, right? And one day, you know, working 20 years, he decided that, yeah, you know what? I wanted to open my own clinic. And, you know, so he packed his bag and he moved to a rural area, right? So near a village. So he started to open the clinic there. And the people there, actually, they are like some small village over there. And one of the places, the village there, have a lot of villagers who are so happy to hear that there is a bone doctor or orthopedics, right, coming around. So every day, the doctor will receive patients from that village. You know, people with broken bones, broken legs, broken hands, broken arms, right? And he does his work very, very well. And he fixes them, he sends them home, everything's good. But you know, over time, the doctor started to wonder, and he asked like the right questions, right? How come people from this village, you know, how come there's people with broken bones every day, right? So this is like a valid question. So what he did is he went to the village actually, and he saw that actually in this village there is a lot of potholes, a lot of area where people can fall apparently, and it was never fixed. So instead of being a doctor in the clinic, he joined the community, you know, fixes all the holes. So now there's no longer people with broken bones, except for people who I guess like fall down from trees. But yeah, you know, so it really it's an imaginary story, right? So this is like a hype tale. It's not a real story, but it really highlights to us, you know, how important community work is. You know, working in clinics, just in clinics that don't really represent the reality. Okay, right. So story time over. We can go on with the slides. Right. So the first thing, I guess that I can introduce to you all the content of our webinar today. So we're going to talk about some introduction to ThriveWell as well, and talk about some of the principles of community mental health, right? We will talk about Bronfenbrenner ecological model, we talk about trauma-informed care, and also next, and we ask question like, why do we need community mental health? And how we can learn through community work, and some of the programs that we have in ThriveWell. Okay, next. All right. So first of all, you know, about us, you know, if you're wondering who is this person talking about community mental health, so ThriveWell is actually from Souls Health. So Souls Health is a NGO, a community-based mental health center that connects clients to accessible individual, family, and community mental health. So what Souls Health is actually an NGO where they wanted to combat mental health stigma to help communities, right? And this is in 2015. But earlier, in late 2020, 2001, in July, right? So now we are known as ThriveWell. So we move out of Souls Health, and we are now a social enterprise that, you know, really have a mission to expand trauma-informed community mental health services. so particularly to marginalized and high needs communities in a sustainable manner. So as you can see, we already have 900 plus hours of community programs. We have seen a lot of individual clients, and we have a lot of interns and associates with us as well. Okay, next. All right, so this is basically our vision, and just like a highlight of why we have this kind of vision. The first thing is there is an increase of mental health issues right now in Malaysia, right? There is an increased incidence of stress, depression, anxiety, and suicidal behavior in the past decade. And let's just not talk about past decades, right? Let's just talk about, during this pandemic, there's a lot of news about suicidal behavior, and this really worries us, right? So, excuse sorry about that. So, the increase in this is actually why we are shifting from private and institutionalized services to more like a task sharing and shifting the approach. And also we have a lot of limited preventive services. So mental health care, it's only like 1.3%. Sorry. It's 1.3% of total public health care on mental health. So most of the budget in medical care is actually in hospitals and biomedical approach. And there's very limited, affordable, accessible services. And for Thrive Well, we we wanted to move towards trauma-informed services. I will introduce you to trauma-informed services a little bit later. And also the stigmatization, right? The stigmatization of mental health is really strong in Malaysia, right? There's a lot of there's a limited education system, right? Limited understanding of what causes mental health, what are the determinants of mental health issues in society, right? So this is why we have this new mission to develop resilient communities and organization. And we, like I said, we try to specialize in trauma-informed care framework. And we want to transition the community mental health to like something that is sustainable. So that is why we move away from NGO into social enterprise, right? And we advocate for trauma-informed care in cooperation in system of care. Right? So next. All right. So what is community mental health? Right? So we can talk about first the pathway of a mental health practitioners. So all the students here right now, aspiring psychologists, for example, maybe aspiring practitioners, you can be in healthcare, you can be a clinical psychologist. Well, psychiatrist is more like a medical field, but clinical psychologists, counselors, therapists, they are all in this primary, secondary, tertiary care. So primary, if you don't know, like primary care basically means the first person who met the client, right? So this can be doctors, general practitioners. So usually if you are a psychologist, you basically would be either tertiary or secondary care. You're not the first person that, usually, generally speaking, you're not the first person who's going to see the client. And in corporate fields, you can be in human resources, you can be doing consultancy, and sports psychology, forensic psychology, one of my own passion, right? I mean, forensic psychology. You can also do marketing, but community mental health is not as popular, let's just say. It's very rare for me to hear anyone who would be interested in community mental health. I mean, just speaking from experience, right? Okay, but it is one of the fields that you can go in to really make a change in society. Right? Thank you. Next. Okay. So Bronfenbrenner ecological model. So the reason why I wanted to highlight this is because this is basically the fundamental and the basics of it. So Bronfenbrenner say that development of an individual is largely influenced by interaction with the surrounding systems, right? So Bronfenbrenner is a clinical psychologist born in Russia, working in USA, and he started this theory to really explain that a child is influenced by their environment. So it's not as if the child lives in a bubble. He or she is not just an individual, but he interacts with his surroundings. So in his microsystem, perhaps he's interacting with his parents, and his parents also interact with the child. So it's not just a unilateral relationship, it's bilateral. So both parties interact with each other. We have the mesosystem, we have the exosystem, microsystem. I'm sure you've learned all this already. So, this is not a lecture on Bronfenbrenner ecological model, but what I wanted to highlight here is, having this system, we have to understand that a person does not just live on his own. He lives in a society. We live in a society. So, what happened is we need to understand that this society plays a large role in determining a person's well-being. So this is where it comes from, the idea comes from. Okay, so next. So what is community mental health again? So I think there's a slight error in the slides because SAMHSA did not originate the Community Mental Health Act. So what I meant to say is that the Community Mental Health Act is introduced in 1963. I guess that is when President Harry Truman was the USA president there. So before this period of time, right, a lot of people, when they get institutionalized, right, and they're sent back home, but then they become homeless. There's no care for them. There's no community support. So they kind of like push this idea that we need community mental health to really, really help these people function in society. So they have like this mental health act that really shifts the perspective, right? And when they shift this perspective, it becomes really, really popular. And now I think USA is one of the countries that really champions these kind of efforts, community mental health, how important it is to really strengthen the community to make sure that people who are sent back into the community are able to function and able to work and live their entire life, up to their optimal level. Okay, so next. All right, so community mental health will encompass incorporating the social determinants of mental health. Okay, so we need to understand what determines mental health, what causes it, what causes issues, and also viewing individuals in a socio-economic context. So there is like a understanding of, what does socio-economic status can really determine in society. We also need to address population needs in a way that are accessible and acceptable, because you have to remember, communities, there are differences in communities, right? Community A is totally different from community B. So we need to understand what is important in that community and what is not. Okay? Right. And then we also talk about building goals and strengths of people who may experience mental illness, because when they go back to the community, if that community is optimal, then they have that resilience, they have that strength to overcome whatever issues that they're having. We also promote a wide network of support, services, and resources. And we also address the needs of underserved population. So if we talk about underserved population, I'm wondering if anyone in the chat box, perhaps they can given what kind of community that comes to mind when we talk about underserved community. Let's just see. Can anyone type in? Right, B40 community, rural areas. That's true. Low SES, orang asli. Yes, that's true. But this is kind of like a community, like a larger community, right? What about smaller population? What about a subset of population? Let's say, elder people. That's a subset of population that we don't really talk about. What about refugees? What about mothers? Single mothers, for example. And so these are subset of population. So it's not just single mothers, right? So it's not just a big community. We can also think about communities in more specialized terms, right? Yeah, old age. Yeah, and some people talk about LGBTQ communities, for example, minorities, say racial minorities. Okay, so next. Okay, so I guess like coming from Thrive Well, I also need to explain, what is trauma-informed care. So trauma-informed care is basically, incorporating the principles of trauma care in our services. So we see trauma as an interaction between ACE. ACE is adverse childhood experiences with adverse community environments. So, for example, a child who have physical and emotional neglect, when they come out of their childhood in a society where there's a lot of poverty, there's a lot of disruption in the community, there's a lot of violence, then the child will be able to be resilient, right? So the issues that they would be having cannot be solved immediately because they're in a society that is like that. So this is what we call trauma-informed care, where we put the principles of trauma to make sure that we have a community where we cater to this kind of needs, right? So trauma is not just we're talking about PTSD cases, like a very very big cases, right? For example, violent abuse or violent sexual harassment, for example. But it really incorporates a lot of things. Divorce can be traumatic for a child. Mental illness can be traumatic for a child. Poverty can be traumatic for a child. A death of a family member can be very traumatic for a child. So if a society doesn't cater to that, there will be issues later in life. Okay, so next. Let's talk about the 4 R's of trauma-informed care. So trauma-informed care, in SAMHSA's initiative, they kind of like put in the 4 R's, trying to explain what is important in this principle, right? So first, we need realization. So we need to have knowledge and understanding of trauma, so that society first, they need to realize what trauma is, what's its effect, and how it can happen, and then recognize a society have a subset of population, for example, who can assess, who can meet immediately the person who are in trauma, right? So this can be general practitioners, for example. And then there's respond. Respond, it can be us, the psychologists, the mental health professionals. So we can have like a very effective and accessible interventions. And then resist. Resist encompasses all, where we have a policy or kind of like an SOP for us to know that, okay, this is what happened when trauma happened. So what should we do to not let this happen again, right? So that is what the 4 R's is. Okay, next. And this is basically just an explanation to the trauma-informed care road. So you can see that I've talked about all this. First, we need to ensure, commitment in integrating trauma-informed culture, and then we include providees in planning and evaluation of services. So basically, trying to incorporate trauma-informed care in a program or in a service. Okay, next. And this is just an introduction to a framework development. So as you can see here, there's two parts. When we talk about community framework, there's two parts of it. First, we need to have assessment, because remember I said that community have their own special needs. The community have their own needs. So we need to understand what it is that they need, what it is the problem for them. And we have a working team, and then we identify the goals that we want, and we develop questions. And when we're able to develop questions, then we can develop plans for it. And then we have all the assessment, the intervention, and the post-assessment. But another part of it is really the engagement with the community. So it's fine and dandy for us to have plans for community, but if we don't go in the community, we don't understand them, we don't talk to them, so they won't be as privy to our effort as well. So building rapport is really important. Talk to the community leader. Also, we have to understand the logistics of it so that it is feasible to do in that community. Okay, next. Why do we need community mental health programs? Okay, so let's just see why. Going to the next slide, please. Okay, so you already have like a brief introduction to Jom Sembang. So I just put in here because I wanted to discuss this in a way that there's an example of this, right? So Jom Sembang project is basically a subsidized delivery of mental health intervention. So we have 100 beneficiaries, which are clients, right? We have 100 clients into this program that is subsidized by Yayasan Hasanah. Okay, so they funded this program. So people from the B40 community, they are able to access psychological intervention. So they need to pay, I guess, like 30 ringgit per session. And even if they have like an agreement where if they end this when they complete all their sessions in a period of time, for example, so it incentivizes them to come to session, right? They can get, I think it's 50 ringgit per person, right? So it really helps them the B40 community to access the intervention or the services, right? And then we have the short report to describe the implication of COVID-19. So this is a program that specifically caters to the pandemic and needs, right? And then we share the findings through various online platforms. We have reports, we have radio talks, right? Okay, so next. Let me just show our findings just a little bit. So a total of 96 clients. 96 is basically the 4 clients that's not here is excluded from the report, basically, so that we didn't put them into the statistics. But as you can see here, 73% reported household incomes below 1,999 per month. And this is kind of like the lower tier of B40. And if you can imagine, we have 100 clients, right? This is a very, very small subset of the population. And 73% is 1,099 ringgit income. Can you imagine a lot more people are actually unable to access our services? This is why I always say, being a psychologist, for me personally, I'm up here. But the people who need me are all down here. They cannot come to me. Okay, so this is the issue. If you can just see here, 60% of them are unemployed, 30% are students, 30% are without fixed earnings. So they don't come to intervention. These people with that 1,000 ringgit per month, they need to buy food. They need to make sure their shelter is there. They don't have money to spend on psychological intervention. And Excuse me. And if you can just see here, 37% of them experience domestic abuse. 37%. Okay, let's just talk about the 37% just a little bit, because we partner with WAO as well, so Women's Aid Organization. So a lot of their clients are actually women with domestic abuse cases, right? So it really inflates the percentage, but even if we take that out, it's still about 20%. So that's a lot. And during the pandemic, the rise of domestic abuse reports really skyrocketed, right? And 44% of that 37% face more than one type of domestic violence: physical and emotional, verbal and physical, for example. So this is not a small issue. And these people, they need us, but they cannot access us. Okay, so next. Let's talk about some of the issues in relation. Okay, I like to use this to illustrate what's going on here in terms of accessibility, right? For psychiatrists, we have 400 registered psychiatrists, which is a ratio of 1.3, a person and a third for 100,000 people. And this is not good. And these are psychiatrists, right? There's a lot more psychiatrists than other mental health professionals, well, excluding counselors, of course. And if you can see here in Kuala Lumpur, we have like the best ratio. So 5.2 per 100,000 population. But look at the states of Sabah and Kedah. There's like a half of a person for 100,000 people. And this is an issue. Look at the clinical psychologist part. We have 300 registered clinical psychologists. 200 are actively seeing clients. And the ratio is 1. You can see 980,000, right? So just imagine, being a clinical psychologist in Malaysia, there's a lot of people that we just can't reach, but there's not enough of us, right? And counselors have a better ratio here, but it's still very small compared to what the population really, really needs. Okay, so next. Okay, so again, let's talk about the rising trend of mental health issues. 1 in 3 Malaysians have experienced mental health problems. Right? So if I were to pick 2% in this webinar, and the 2 of you said that you don't have mental health issues, then that's probably me lah. I have mental health issues. So that's how prevalent mental health issues is, right? And there's a twofold increase in reported case, and this is from 2006. And we see it ourselves in this pandemic, right? A rise of cases. But the thing is, the pandemic does not create the issue; it aggravated it. So it means that this is something that has been happening for a long time, but because the pandemic comes, it aggravated the situation. And then we see another issue is the ambiguous coverage of existing healthcare policies. Most insurance company does not recognize mental health illness as part of insurance plan. I think like a few years back, I have coverage in mental health insurance, but still there is a lot of criticism there, because there's it seems like they don't cover enough, or it's not enough for their clients, right? It causes the lack of accessibility, and also because we don't have like policies. For example, we don't have, so it becomes like a problem for our workers to disclose or to find help, because there's no protection for them in the workplace, because there's no policy about it. If an employer fire a person from their job because they have mental health illnesses, that worker won't be able to get justice for it, because there's no policy in it. Okay, right? And then of course the stigma and lack of literacy. So I put this in as literacy instead of awareness, because I think like moving towards like at this time, right, mental health awareness have been increasing a lot. Right? We know what mental health is. A lot of people know mental health is, especially the younger generation. But the thing is, awareness does not equate to literacy. Literacy means that we know, we understand what it is. We have the correct knowledge about it. Awareness does not always equate to literacy, and it can become a problem as well. It's good to have awareness, but literacy is like the next step we need. And the stigma in community is still strong, and it becomes a major barrier in help seeking. Right? Yeah. Next. Okay. So let's talk about help seeking just a little bit. So there are various factors that can really affect help seeking in terms of mental health. We talk about educational levels. People with higher education levels are more open for mental health services. People with lower educational level have a lot of stigma and lack of literacy and awareness in this. Socioeconomic status, people who are in the lower end of the socioeconomic status tends not to be open to mental health services. Levels of stigma really influence the help-seeking behavior. Age, for example, like I said, youth now are more open to it. But what about people who are older in age, who still need help, in mental health services, but they cannot access it? Status in society, marginalized community. I have a lot of refugee clients, especially, they don't come to mental health services. They only come because, there's like a, for example, charity program really push them to get that mental health services. But people who don't, they're there, right? And also accessibility and feasibility. Just remember, like working in a clinic in HUKM, I have a client who they come to the session and they, this is a mother, right? The child has neurodevelopmental issues, and every time she comes to the session, she would count her money and see how much she have left for the week. She lives far away from the clinic, and she took Grab, I think like it's about 20 ringgit. She comes to the clinic and go back 20 more ringgit, and she need to count how much she have left for the week. Just think about this. This is one client. There's a lot of people like this. They cannot access our services. And then the fundings for this mental health efforts and program can really determine the effectiveness of a program. And the ecosystem of the community plays a large role. So a community which is more open to mental health issues, or a community is more supportive of people with mental health issues, it really affects how a community, a person with mental health issues can really survive in those kind of communities. Okay, next. Okay, so I'll share with you just pre-post results. This is not, so if you can see here, there's actually a decrease of depression, anxiety, and stress scores, significant decrease. And also for the WHO call, the quality of life, if you can see, there's a lot of increase, significant increase. And the reason why I share this is not to humble brag, but really to tell you guys that this effort is worth it. Okay, it's like this is like a small program. There's 100 clients, but this really shows that these kind of efforts should be championed. It should be done because there is an effect. This is the effort that's put into it is worth it. So we need to do it. Okay, so next. Yeah, so let's champion this type of efforts even more. It's kind of like an inspiration for all of you. And then what do we learn to the community? So again, The community don't just learn from the mental health providers, we learn to the community as well. So next. Okay, so you can see here what we can learn. We study the community needs, priority, and resources. And the important thing here is to remember that in a community, even if we understand the needs and priority, is not enough. We need to understand what drives them. What are the resources that they have? It's because a community won't function if they have no resources, right? So what makes this community thrive? If we understand that, then we would know what helps them, right? And we recognize trauma and development of programs, and we promote and strengthen social support within community members, not just within the community members, but us and the community. And we promote mental health in the community, okay? And we contribute to reducing stigmatization, and we foster community resiliency. When we work in community work, we help that community foster that sense of resiliency, so they don't rely on us. So again, like I said, they cannot have access to our service, but if we can provide that resilience in that community, then that community can thrive on its own. So again, like the bone doctor, they don't need to come to the doctor every day. They're able to live happily ever after. Okay, and we can coordinate with other organizations. So for example, in this example, we have WAO. We coordinate with them. We provide a safe space for community members, right? So when we do our programs in community works, we provide a kind of like a space for them to talk about issues that they otherwise won't talk about in that community. And it's good that we also witness dynamic changes, right? Dynamic changes within some families. So you can see not just changing that individual, but changing the society around them, the system around them. You can really see the changes that happen. And it also improves our reflective practices as well. And I'm talking about, peer supervision when discussing about things. It's no longer just this individual this individual that, but what are the system around them that really helps or hinders their life. Right? Next. So this is just an introduction of some of the services and programs that we have, just to give you an idea of what you can do in a community work. Right? So we have professional services, of course. We have like therapy sessions. We also have corporate services. We work the organization in EAP. We have our Job Sema project. So we are going to start a new Job Sema project under the funding of Puak Payung. So this is going to be soon. We also have Brave project. We partner with women's aid organizations. So WAO work with us. They have their own like in-shelter and off-shelter clients. And because we are here as a mental health service provider, they can send their client that really need that help to us. So we have that collaboration there. Okay? So we have people who handle all the shelter cases, and then people who need intervention, they can send to us. So that's how collaboration can work in a community project. And then we have program partnerships. Women of Will is PPR project. So this women in PPR, they have like their own community. We do workshops, for example. We have Miasa. We have Fuji School. Fuji School are school for refugees. So we have partnership with them as well. And we also have Kami. So Kami is kind of like a program that focuses more on family dynamic. So Kami Juara, we focus on children or adolescents. So we do workshops and training with the children. Kami Sembang, we do training with the parents. And Kami Booster is that we do intervention and training for both parents and children. So you can change the family dynamic, really change that microsystem in the child's environment. Okay, next. Okay. So I just wanted to share you our thriving moments. And again, this serves as an inspiration for you and also kind of like an idea of what you can achieve community work. Okay, we have the Wanita Berdaya Selangor postpartum depression research. So from this research, what happened is mothers with postpartum depression, they are able to access or have kind of like a research that helps them to kind of like work out a policy to really help these kind of women who are having issues with postpartum depression, right? And we have like the women's livelihood socioeconomic impacts. We have assistance to B40 communities. We work with Souls 24/7. We map B40 communities so we can really understand what are the needs of the B40 communities. And we also, like I said, we have the Jom Sembang Yayasan Hasanah Grant. So these are some of the programs that we have, kind of like an idea of what you can do in your own work in community. Okay, next. We also have public education. So if you're doing community work, this is basically what you're going to be doing. Public education, awareness, we have talk shows, we have talks like this, webinars, we have campaigns. So these are the things that you're able to do in community work. So next. So these are just pictures, the KAMI programs. You can go next. Next. I guess you can just press next on the few more slides here. These are just pictures here. Okay, so let's stop here. Just a promotion. So anyone who is interested, we're always welcoming you. Like internships or masters or any kind of volunteer work. We really need more people in the community work to really make a difference, right? So this is just a short promotional page. So do let us know if you are interested, okay? So next. And this is our Instagram and also our social media. So I guess that's all for today, webinar. Thank you so much for listening. We can go to Q&A next, I guess. Right. So do ask questions. I will be happy to answer you.
Thank you, Ms. Anum, for sharing your valuable insights about mental health services and also how to get. Thank you for sharing with us to how to get help to those who are not able to access it due to the challenges that they face, especially with the current environment in Malaysia, regarding with their lack of resources. Thank you for sharing about the importance of community mental health, understanding what is important in community and build wholesome strength, and also trauma-informed care, the importance of society to understand what trauma is, the interaction between adverse childhood experience and adverse community environments. And thank you for sharing Jom Sembang project, like how it's providing psychosocial intervention to the hundreds of clients from B40 communities. So now we are going to open the floor for Q&A session for 10 minutes. Please use the chat box to post your question. And for those who are watching us live on YouTube, feel free to type your question in the chat box and our team will pass the question to Ms. Anu.
I already saw some questions here.
Yes. So the first question from Ethan Gaines. Hi, Ms. Anu. Just wondering what interventions, modalities do you find most helpful when working with those in the unserved communities? And where should we start if we want to discover more about working with such groups?
Okay. Right, so thank you, Ethan, for your question. Okay, so I'm hoping that you are interested in community work. So welcome. Right. So intervention and modalities, right? When we talk about underserved population or specifically, for example, access interventions, for example, if we're talking about the interventions, right? So a lot of push for task sharing would be great. So for example, task sharing is that the society itself, the community itself are able to attend to people with mental health issues. For example, maybe they have some kind of what's that screening skills, or they have some kind of psychological first aid skill. So we share our task with people who are not mental health service providers, so that they can have access, because they have access to these people, and the people who cannot have access, they can come to us. So we kind of like sharing our task here. And also in terms of intervention modalities in B40 communities, we're talking about short-term therapy to cater to that community, right? For example, social focused therapy, these kind of brief therapies to really give them what they need, but don't really push them to be able to just stay in therapy for for a long time, right? So it's not feasible for them. It really depends on the community that you're working with, but you have to understand what they need and really adjust your modalities with that. And also, where should you start if you want to discover about working with such groups? You can start working with us, or you can. There's a lot of NGOs in Malaysia that really caters to this. NGOs, you can go for, for example, in Fuji School, they need volunteers, so you can just look in. Let's see, if you can check in the internet, if you can look for NGOs or service providers for a minority population, you can usually find them there lah. Okay, I hope I answered your question.
Thank you, Ms. Anu, for answering the question. Thank you, Ethan Games, for the question. Our second question is from Haira Rushdie. How did Tribal sustain itself financially by providing services to underprivileged?
Okay, thank you, Kyra, for the very important and very smart question. Right, how do we sustain ourselves? So this is why we move away from NGO Souls Health to a social enterprise, because basically what we want to do is to sustain our efforts, right? If we just wait for fundings, for example, if we're NGO charities funding, we won't get anywhere. So by and how we do this is by providing these kind of services. So we have the EAP programs with the corporate. So we have a lot of financial, we got a lot of help from there. We have our own professional services. Even in if you go to our website, we have tiered lists, right? So people who are able to pay more, they will have their own kind of like, what's the word? The price they have to pay for a certain intervention differs according to their income or socio-economic status, right? So this is how we sustain ourselves. We sustain ourselves also through grants, to trainings, through workshops. So this is how we try to sustain our programs.
Thank you, Ms. Anu. Our third question, from Marshall Steve. Do Tribal have any plan in the future to open their branch at Sabah at Sarawak, since Sabah has the highest rate case for mental health issues?
Right. So if I'm
Especially
not
in the rural areas.
Oh, okay. So Marshall, thank you for Sabah. I think we have like a new center there in Miri. So we're just starting out. So there is a center in Miri. So hopefully in the future we can branch out more. But in Miri we already have one. Just starting out. So it is in our plan to kind of like branch out where we can really have in certain areas that's not accessible to a lot of population. Right? And I just saw the chat box here, Ethan as SFBT. Yes, solution focused brief therapy. Okay. So
okay, Ms. Anu, There is a participant, Wafi, he wants to ask a question directly to you. Wafi, you
Yeah,
can
sure.
unmute yourself and ask the question.
I'm sorry, it's not clear. Can you?
Yes, please. Thank you, Sanjida. Thank you, Sanam. Thank you, Sanjida. So my question is, I wanted to seek for mental health help a few months back because of the MCO, right? But I've got certain professionals told me that if you go to a psychiatrist, you will have a record, for your health. And if you really like to seek for a job, and if you have that record, that will be a bit harder because of the social stigma of these mental health issues, right? So that's my question. Are the stigma still here, or you can freely go to a psychiatrist now, and you will not be recorded? You see?
Yeah. Okay. So thank you for your question, and I'm really sorry for your experience. But the thing is, it's a really normal experience for a lot of Malaysians having like, mental health issues. I have a lot of friends in the medical field, and they kind of like say the same thing, right? If they went for medical for mental health services, they're afraid of getting this recorded, right? So in their yeah, it is unfortunate, but the thing is, when you go for mental health services, what happened is usually we don't let out the record, your record. So only if there's like a let's say court cases. So that is the only instances where we can give your record to other people. But this is kind of like a very small percentage of cases lah. So by right, your record should not be given to other organization. So in case like you're going for psychological services, the place of work should not have your record. Like you, they should not have your medical record. So this is why I say that the policy in Malaysia don't have that protection for workers, not yet. So I'm hoping that you have this kind of experience. I'm hoping that you can also champion this as well, because you know how hard it is for yourself, right? So this is what we wanted to have, like this policy to really protect people, to really help people who are having issues and not being afraid of going out and helping them. So yeah, and also answering directly your question, is the stigma still there? It's less of a stigma, it's more of a policy thing, right? The policy really strengthen the stigma, for example. Yeah, so if we don't have a policy that really helps people, then the stigma will be big, because there's no conversation about it. People don't talk about it. So this is the issue lah.
Yeah. Thank
I
you.
hope I answer your question.
Yes, thank you so much. Thank you, sir.
Thank you, Ms. Anum. Our next question is from...
Excuse me.
Sure. Okay, so our next question is from Wei In. How is community health and public health differ, or both of these are the same thing?
Community health and public health do differ. So community health is basically what we're doing at community and mental health services. Public health is more, it caters a lot wider, like the medical medical field, for example. So there's a lot of overlap, but it really is something different. So when we talk about community health, there's a lot of things like policy creation, a lot of awareness program, a lot of workshops. So that is community health. Public health is a little bit different than that. So again, there's a lot of overlap, but it's also it's something different.
Thank you, Ms. Anu. Our question this time is from Kaji Sumaya. She said that, is it possible to only volunteer for 3 weeks at a time? She's asking because she is a full-time undergraduate student and the only time she gets the time off is during the holidays.
I think I'm sorry. I think it's possible. Right. So if you go to our website, you can either ask directly through email, or usually what happen in interviews, right? We will ask you, okay, how much time would you be able to volunteer? So we can cater to that as well. So if you're really interested, you can either ask, or you can just apply, and that can be discussed in the interview session as well. So again, there's a lot of volunteers and associate with us. So there's a lot of people who work only a certain period of time, and they don't have anything, any programs for a while. So that happens a lot actually.
Thank you, Ms. Anu. Our next question is, from Khaira Rushdie again, what kind of tasks will we do if we were to volunteer at ThriveWell?
Okay, so a lot of people are interested. Okay, yay! So the task that you will do, basically, it really depends on who you are or what your specialty is. For example, we have the center coordinator. So center coordinator is basically people who have like a first-hand experience with clients. So they are like the first people who's going to meet the client. They will coordinate all the center's services. We have psychologists, we have volunteers in terms of programs. For example, in Kami programs, we have a lot of volunteers there to do the program. So it really depends on what you want out of your experience, and also what you can give us. So we provide you an experience that you can learn more about community work. So there's a lot of things there you can do actually.
So I can see that the time allocated for Q&A is running out. So before we move on to the next plan on our agenda, we can have one more question from the floor.
Yeah, I saw ping questions there.
Yes. From ping, Ms. Anum, the question is, this is the last question that we are taking. I was wondering what do the programs focus on to build resilience in the undeserved communities?
Okay. So the programs that we do, like I said, task sharing is really important. So the program where the community can build their own resources, pool of resources, right? So they don't just need to go to mental health services all the time. They can handle it themselves. They can have resilience in that community, helping each other out. So people with mental health issues don't have to, if they don't need to, they don't have to go for higher services or inaccessible services. They can thrive in their community. So those are the kind of programs. We have workshops for reducing stigma, talking about suicide, for example, talking about mental health issues. There's kind of literacy programs. So these are the kind of programs that we do to build resilience in underserved communities. So basically, the principle is making sure that the community have what they need to cater to their own needs, right? So it's like a stronger community to really help people with mental health issues.
Yes, I guess there is no more question. Thank you, Ms. Anum, for your time in sharing experiences. And thank you all for your questions. Yes, we shall now proceed to our next agenda, which is the Instagram Reels competition.
This Instagram Reels competition was organized as a part of our effort to promote awareness among the public on how to cope with the COVID-19 pandemic and the consequential limitations in access to psychological services in the country. There were two categories from which the participants could choose from. Category 1 was self-care, where participants shared their experiences on self-care, their tips and tricks. And then category 2, family matters, where participants defined what family means to them and cherished moments with their families through 30 seconds to 1 minute reels. Individuals who participated in this competition stand a chance to win prize money up to 100 ringgits. The winners were decided based on the number of likes, as well as how well they have presented the topic of choice. Let us now sit back and enjoy this compilation on Instagram Reels from our winners in category 1 self-care.
뒤를 볼 수 있을까? 온 세상이 바뀌어가도 아직 나는 그대로인걸. 내가 걸어가는 이 길을 꿈꾸던 그때 그대로 내 매일을 춤추던 처음 그 자리에 남아있는걸. But you never know if you're rocking the shoes. You never know, 켜버린 the curtain. 'Cause everybody sees what they wanna see. It's easier to judge me than to believe. 그 숨겼던 날 생각들과 그날을 잡고 괴롭히지만 그럴수록 I'ma shine, babe. You know they ain't gonna shine on me. 'Cause in my world I'm constantly having a breakthrough. Or a breakdown or a blackout. Would you make out with me underneath the shelter of the balcony? 'Cause I don't need anyone, I don't need anyone. I just need everyone and then some. I don't need anyone, I don't need anyone. I just need everyone and then some. Wish I could see what it's like to be the blood in my veins. Do the insides of all of my fingers still look the same?
When I'm at my lowest of lows, I find it difficult to accept anything others say. Be patient, be strong. It makes me feel like I wasn't patient or strong enough. Now don't get me wrong, I appreciate the concern and the care, but in that state, my mind, and at times my heart, is numbed. Have you ever felt that way? It's alright, you know, to feel that way. Sometimes it just means that you need to stop, breathe, and let go. Look up at the sky, touch some grass, have a glass of water, or in my case, I like to journal my thoughts, make some tea, and spend some time with my cats. No, it won't erase your worries or solve your problems, but give yourself space, and you may find that life isn't so bad after all.
Hi everyone, I'm Suzy. So today I will be sharing with you guys how to cope with social anxiety. So social anxiety is a long-term and overwhelming fear of social situations, such as I don't want to go to the school again, I don't want to meet people again, I'm scared that they will judge me. So if you are also feeling like that, now I will share with you some tips that you can use when you are in social situations. So first, when you start to feel nervous when talking with other people, you can try this one technique called breathing exercise for stress. Second, try to acknowledge that you are feeling nervous or shy when talking with them so that they understand your situation and you can also feel at ease. And third, try to focus your energy on other people and their story. Rather than stuck in your own anxious mind, try to remove that negative thought of others and let the relationship go.
Once again, a heartfelt congratulations for the winner of the Instagram Reels competition, self-care category. We hope that you enjoyed this creative and fun Reels and get reminded that self-care is an important part of our lives, especially in these tiring pandemic times. Now, before we go for a lunch break, please reminded that in the afternoon session, we will have a workshop on how to support someone in need, followed by another webinar that talks about pandemic and access to mental health services. Furthermore, we will announce the winner for the Instagram Reels competition Family Matters category. We encourage all of you to share this event with your friends so there are more people benefiting from this event. If you are sharing this event on Instagram, please tag uoc.psyche.official and share with your friends. Please have a good lunch, a cup of coffee, and be back by 12:55 p.m. to join the afternoon session. See you all soon.
All right, welcome back everyone. We shall now proceed with the afternoon session of this mini symposium. Next on the agenda, we have a workshop on how to support someone in need by my fellow clinical psychologist trainees, Ms. Lee Kaishin and Ms. Varshini Tanabalan, who will be discussing on how to support someone who's experiencing distress, such as depression, anxiety, and grief. Let me warmly welcome Ms. Lee Kaishin and Ms. Varshini Tanabalan. Over to you, Ms. Lee Kaishin.
Hello, everyone. I will need to be allowed to share screen, sorry. All right, thank you. Okay. Shall we wait for a few moments for the participants to come back at 1, and then we will start our workshop?
Yes, we can wait till 1 p.m. and then we can start.
All right, thank you.
Hello everyone, just testing to see if you can hear me. My mic is working? Okay, thank you.
Welcome back, everyone. Hope you all are joining for the evening session. How was your lunch? Do you all have a cup of coffee for the afternoon session?
Got your energy all back up, all hyped up for the afternoon session?
We're happy to see you all. We're still waiting 1 minute for all of you to join back, and then we can start our afternoon session. Please stay hydrated, have water beside you while you're attending all the sessions.
I can see there's a lot of hype in the chat box. A lot of excitement coming from the participants.
Yes, everyone is waiting. Very excited to have you all as well. Good afternoon. Good afternoon.
Everyone seems
Okay.
extremely excited.
Yes. I think we can start our afternoon session. Yeah.
All right, good afternoon, everyone. So I'm Kaishin, and with me is Varshini. So we are going to talk about how to support someone in need. Let's say your friend or family, someone you care about is having mental health issues. What can we do? So here are some friendly reminders for our workshop today. Turn off your microphone and feel free to type any questions you have in the chat box, and we will entertain your questions at the end of our presentation. These are what we're going to discuss today. Part 1, we are going to present about these topics, and part 2, we are going to go into different breakout rooms where we will see a video demonstration and have a discussion about it. All right, so how do we approach and talk to the person we are concerned about? Firstly, choose a suitable time for both of you where it's comfortable and safe for both of you to talk, because it's not easy to open up about your personal struggles. So it's important to ensure the privacy and also make sure that you are ready to listen. A suitable time for you. So we could say something like, I noticed that you're quite down lately. Are you okay? Do you want to talk about it? This is a way that we could start the conversation. If the person is not ready, it's fine. Do not put pressure on them to talk. We can let them know that we are available whenever they are ready. Like, it's fine. You can contact me whenever you're ready to talk. Respect the person's privacy and confidentiality. So because these are people's personal matters, so we need to respect their privacy and keep their confidentiality. Unless we are concerned that the person might be at risk of harming themselves or others. This will be addressed later in our presentation by Varshini, like assessing their suicide risk. So in that case, a more direct action will be needed, but otherwise we would need to respect people's privacy. If the person is not comfortable talking to us, we can encourage them to talk with anyone they trust or is comfortable with. Next, we listen and communicate non-judgmentally. So we take them seriously. We do not make jokes, like try to lighten the mood or anything, because what they are sharing is true, what they are experiencing. So, and also we do not interrupt with our own stories like, oh, there is a similar thing that we experience, because it may not be the same. Listen without expressing judgment. So because we are not them, it's not in our place to judge what they are going through and how they are thinking, how they are behaving. So we might not agree with what they are doing or what they're thinking, but we can listen and accept what they say. Allow silence and space, meaning sometimes there may be silence in the conversation between us, but it's fine, because when we are overwhelmed with a lot of things, a lot of challenges, a lot of distress, we may need some time to think and organize our thoughts. So it's okay to be silent. Allow some silence and space. And also allow the person to cry. Sometimes when we see people upset, we may say something like, oh, cheer up, don't cry. But if you allow the person to cry, it may be an outlet for them to relieve their emotions. Other tips about listen and communicating non-judgmentally. So we could ask the person to know more about the situation, like how do you feel? How long has this been? So this could encourage the person to talk more about the situation. We could summarize what the person is saying to convey that we are listening. Like, oh, okay, so I heard that you said this. Did I get you correctly? This is also one way we can clarify if we got them correctly, if they are understood by us. Clarify important points is something like, because sometimes like people may talk a lot about, they may share a lot about what they are experiencing, and we are not sure if we are getting them correctly. So we could clarify like, oh, when you say this, do you mean this? Or when you say this, what do you mean by that? That is how we can clarify with them. Expressing empathy. So empathy is imagining ourselves in their shoes. We can imagine if the same thing that happened on them happened to us, how would that make us feel? That could give us kind of an idea about how the person is feeling. Although of course everyone faces challenges differently, so it might not be the same, but it could kind of give us an idea how the person may feel, and we can communicate, express our empathy by saying something like, oh, that must be really hard for you. That's a very tough time to go through. We acknowledge how hard it is for them and let them know that they are not alone in this. And besides language, like nonverbal languages, like their tone, expression, posture may give us some clue about how they are feeling and give us a clue about understanding them. But of course, we need to clarify with them because language is still the most reliable indication about the person instead of nonverbal languages. Next, we offer support. One thing to take note of is that everyone deals with challenges differently. So sometimes people may want them to hear, may want us to listen to them. Some may just want us to like accompany them silently, but some, they might want to think about things themselves. They want to have some space for themselves. One thing to take note about having space, like leaving them alone, is that you need to make sure that the person doesn't have the risk to harm themselves or others. In those kind of cases, a more direct action is needed, but otherwise it's fine. We can give them some time and space to think for themselves. So when we are offering support, some of the questions we could inquire is, how can I help? Because people may have different preferences. So it's important that you inquire them how they wish that we help. And another question we could ask is that when you face similar situation in the past, how did you cope? Because when we are feeling very overwhelmed about a lot of things, we may forget that in the past, we have faced similar situations and we have dealt with it. At the point when we are overwhelmed or very emotional, we may forget that we were able to cope. So by asking this question, we remind the person, oh, actually, I did this before. And we could ask them what are the ways that they find useful in the past. Okay. And another thing, we could ask if they need any help with daily tasks. Sometimes just a very simple help would take off a lot of burden on them. So we could offer help like doing some simple house chores or running some simple errands for them to help to lighten their burden. But take note not to take over completely or encourage dependency, because if we take over completely, the person may feel told very, very helpless, like there's no thing that I can do. And also we know that being active in daily life keeps us energized. So it is good to have a certain amount of activity in our everyday lives, a suitable amount, a suitable level of activity that the person can handle. Don't take over completely. Next, we encourage the person to seek professional help. So we communicate that mental health issues are common. In every 10 Malaysians, 3 experience them. So now we have like 107 participants. So even in this webinar itself, 30 of us, around 30 of us, are experiencing mental health issues. So it's very common. The good news is there is hope for recovery if we seek professional help. So we want to give the hope to the person. If it's within our ability, like if we have time, we can, if we can devote our time, we could offer to accompany them. We can offer to book an appointment for them and accompany them to their appointments. It may help them feel, less lonely, less helpless, because there is someone for them. If the person is not ready to seek help, let them know that they can approach us if they have a change in mind. So it's similar to what we mentioned just now, like when you are ready, you can contact me. Again, unless they are in danger of harming themselves or others, that's when we need a more direct action. Also encourage the person to seek social support, because research has shown that social support is very important for mental health and is very important for recovery from mental health issues. What if the person refuses to seek help? So firstly, we want to find out why is the person reluctant to seek help, find out the reason. Are they concerned about the cost? Are they afraid because they don't know how is a psychological session like? For example, they may worry if they will be judged, or that like if they attend sessions, if others will know about what they are experiencing. Or do they think that if I seek help, does it mean that something's wrong with me? Does that mean I'm weak or I'm crazy? All right. So we find out why, find out the reason behind the reluctance. And then after we know the reason, we can offer information to help them understand more and also to break their misunderstandings. So for people who are not don't understand, they are not really familiar with psychological services, we can let them know that sessions are private and confidential unless the professional is concerned about your safety and need to break confidentiality to get help. So it's private and confidential. It offers a safe and comfortable space for you to open up about your concerns, and you can follow your own pace. So there's no rush, and you don't have to worry about, I don't know what to say. It's fine. The clinician will guide you. The clinician will ask you questions, and yeah, so you don't have to worry about not knowing what to say, It's your choice to decide what to say, and if you, only when you are ready. You don't have to talk about any topics which you are not ready yet. For example, it might be very, very painful. It's fine. Take your pace, take your time. About the cost. So it's better to find out the cost by contacting themselves, because like for private sectors, the price there's a big difference in the range. So contact any center or organization that you're interested in. And then there are also helplines and NGOs that offer free or lower cost services. Varshini will share about this later. And then there are also public hospitals and Mentari. So Mentari is a governmental initiative, governmental initiative, like a community mental health service center. So you could always Google search and find the nearest Mentari if you are interested. All right, so about who seeks psychological services, who are they for? Actually, mental health professionals provide services to help us learn to cope more effectively with any life issues we have. Just like in this morning, we have different workshops like stress management, communication skills, time management. These are a kind of, you can get a sense of how psychological services are like. The difference is that the sessions are more individualized than what we did in the workshop. So it teaches us to cope with more effectively with what we are experiencing, as well as any mental health problems. It helps us understand more about what we are experiencing and to cope with what we are experiencing. All right, I will pass over to Varshini about suicide risk assessment.
Hello guys, so I'm going to be talking a little bit on the suicide risk assessment. But before that, if you guys have any questions or anything, please feel free to ask them, and you can post it in the chat box as well, and we'll attend to it a little bit later once we're done with this presentation. Okay, so moving on to the next slide, please.
Oh, yeah.
Okay. So as we mentioned, I'm going to be talking about suicide risk. So this includes looking out for, the first thing is looking out for specific indicators this person may have. So some signs to look out for could be the level of stress that they're under. Do they express any threats of wanting to hurt themselves? Do they express any feelings of hopelessness or wanting to like end the suffering and feeling very trapped? Also, do they tend to act out recklessly in certain situations? For example, if they're driving a car, then they tend to do it really fast in hopes of getting into a car crash. So looking out for these kind of things will help. And following that, it's also really, really important to ask about suicidal thoughts. Here's the thing about asking if someone has suicidal thoughts, right? The first thing that we should do is to normalize it. So this would mean something like the asking about the amount of stress and pressure that they are under, and stating that some people might have thoughts of wanting to end their life and end the suffering. So have they thought of anything like that? This would be an example of normalizing it. And the second part about this is some people might express concerns. If they were to ask questions like this, then considering the fact that this person is already in a very vulnerable state, would we be planting certain ideas into their mind? But that's not true, because multiple research has shown that asking questions regarding suicidal ideations, thoughts, and all that does not increase the chance of suicide happening. In fact, it provides an outlet for people to speak and to open up, and they can really speak their mind, and it improves their chances of actually getting help. The next element here is to be non-judgmental. So it's absolutely imperative to not disregard their problems or concerns in any way, or say things like, oh, that's such a small problem, why would you have suicidal thoughts because of it? Or that is for people who are like too scared to deal with it. So don't disregard it, don't make them feel small, instead normalize it, because each of us have different level of resilience and vulnerability. So it's best to keep our personal judgment away, as it will serve as a barrier. The next slide. Okay. So now we need to see how high their risk factors are in order to get them the help that they need. So this is how we sort of assess that. Firstly, we need to check on how much they have been thinking about suicide, as in how frequently these thoughts are actually present. And then do they have a particular plan for it? For example, have they been Googling about, the most painless way to experience death? If they do have a plan, then check specifically on how do they want to do it, when and where. It's also important to find out if they're planning on using any weapons or tools. This could include poison, rope, knife, multiple things. This information is necessary to keep them away from these items. And it's also very important to understand if they are regularly under the influence of drugs or alcohol, because intoxication can increase suicidal risk. It lowers our inhibition and it makes us do more risky things. And then we also need to find out if they have attempted suicide in the past, because if they've gone close to it or if they've done it, then it increases their risk again. And finally, it's also important to see if this person is hearing any kind of voices. And if they are, then we need to find out what are these voices saying. Is it also linked to suicidal thoughts? Because it places them at a higher risk. Next slide. Okay, so this is kind of like a summary. It basically means the more frequently and more intense the suicidal ideation or plans are, and the more specific it is, then it places the individual at a higher risk. However, it's also important to remember that the absence of a plan does not necessarily indicate that the person is fine. So it's best to always be a bit more sensitive, to be in tune to it, and to recommend them to get professional help. The next slide. Okay, so in terms of what we can do to help, the first thing would be to explore other options other than suicide. This would include talking to someone they trust, getting professional help, speaking to a counselor, a therapist. And secondly, talking about the positive aspects of their life, like to remind them of things that they are blessed to actually have, and to basically give them reasons to live. Also, remove any tools or substances that is within access that could lead to them committing suicide, like as mentioned before. And it's also very important to help them formulate a safety plan. For example, like the example I gave earlier, if they are triggered when they are driving their car, so maybe offer them a ride instead, or figure out a way for them to be driven around instead of having them take control of their personal transportation. It's also important to discuss when they have suicidal thoughts, who can they immediately contact? So we can either provide them our personal support, like our own numbers, or give them hotline numbers. So give them enough information to like formulate a proper safety plan. And last but not least, it is very, very important to promise them to not keep this a secret, because this is much more dangerous. So in the process of building trust and rapport with them, it's best to not try and give this kind of promises, because it is safer to get them and encourage them to go and seek help. In the next slide, please. Okay, so for those in the high risk category, immediately try to get their permission and ask them to speak to someone they trust, a mental health specialist, suicide prevention hotline again. And if the person has mentioned regarding any weapon, then contact the police and inform them regarding your suspicion, and they will take care of the matter. So this is specifically for those in the very high risk category. And try not to also put yourself in dangerous situation when offering this support. So try to be a bit mindful about whether you're being invasive or not. Don't get into their personal space and attempt to remove these weapons on your own, because it might give room for them to either hurt you or hurt themselves. And if the person has acted on suicidal thoughts, then immediately administer first aid, call the ambulance, or take them to the emergency department of a public hospital, and the rest will be taken care of. And you can continue to stay there, of course, to provide support. That's it for me. Kashin will take it from here.
All right.
Thank you, Kashin.
Yes, I have just unmuted. Thank you. Thank you, Varshini. So I will continue with tips to encourage professional help seeking, because sometimes people may be reluctant to seek help. And after we have tried all the things that I talked about earlier, what if the person is still reluctant? What can we do? So we build trust. So sometimes the person, they intend to solve their problems independently. So if we keep on pressuring them that you need to seek help, they may think that we do not trust their abilities. So what we can do first is to build trust with them, genuinely care for them, and try to understand them more. When the person feels they are respected and understood by us, our suggestion may be more persuasive. Tip number 2, we can be a role model for them. So people may think that, oh, no, it's fine, I don't need help. What we can do is to show that actually mental health is important for everyone. So we could invite them to join talks, webinars, workshops, like our mini symposium today, because it's educational. So we could invite them to join together with us. So we join with them. It may help them realize that a lot of people are also caring about their mental health, and they can learn more about how ways to help themselves. And it can also improve their understanding on mental health issues and break any myths surrounding mental health by attending these talks or workshops. And lastly, a kind reminder that everyone is different, everyone is unique. The way and pace we approach or face challenges are different. So if the person is still reluctant to seek help, what we can do, we can make sure that they can still function in their daily lives. They are still eating well, they are still sleeping well. So if they can still take care of their physical health, we do not pressure them too much to seek help, unless, of course, there is a risk of self-harming or harming others, which direct action is more direction is needed. And we stay in regular contact with them to check on them, how you're doing, how you're going, to communicate our concern and to check their progress, like how they are going right now. And very, very important, when we care for someone who is in psychological distress, we may feel emotional or worn out of energy afterwards. So it may be helpful to talk to someone after you have helped the person. Remember to respect the privacy of the person you have helped. Do not share their identity. And other self-caring activities you can do is to relax yourself, deep breathing, or relax. The progressive muscle relaxation is one of the techniques you could search online. It helps you to relax. Exercising and also doing some activities that you enjoy. Yep, so that's the end of my presentation. Do we have any questions about anything about this workshop? You can type in the chat box, or you could, yeah. Yes, Sanjida.
No, it was Rima.
Yeah, okay.
Thank you, Kaishan. So we'll have 5 minutes for Q&A. So you all can type in the questions in the chat box, and I'll be passing on to Ms. Lee Kaishan. All right, we have a question from Alyssa Lim. What if someone we know needs urgent help, but they are reluctant to seek help?
Oh, okay. When you say needs urgent help, does it mean that they may be harming themselves or their lives are in danger? Okay. So yep, if they are still reluctant, let's say if there is a weapon, like what Varshini mentioned just now, then you need to contact the police to ask the police to intervene, because you may put yourself in danger if they have a weapon. If let's say, it depends also who is that person. If you are very close, you may know the person better than me. So you may need to try out different ways to encourage them to seek help. Or like you could actually drive the person to the emergency department of any public hospital for anyone who has suicidal thoughts, and they will take over from there.
Okay, we have a question from Kili Lau. What if suicidal people avoid from discussing her suicidal ideation?
Avoid meaning when you ask them, they do not talk about it. I think, of course, the first thing is it still goes back to building trust. There may be a reason the person is avoiding discussing. So we want to let them know that we are not judging them. We just want to help, and we let them know that it's not. Anyone could have suicidal thoughts. Even the strongest people can have suicidal thoughts when they are facing a lot of different issues and stress. Let them know that anyone could have the thought, and I'm worried about you. Do you want to share more with me? Really, I guess, show your concern and show your non-judgmental attitude. Yep. Does that help? All right, thank you.
Question from Tasia Kusheiri. What if someone talks about their suicidal ideation, but in a joking way? Should we be concerned?
In a joking way. We could be serious with them. If they are not serious, we could be serious with them and ask, I'm worried. Do you have the thought? Really, again, I guess because there may be reasons the person is joking about it. They may be really joking about it, or they may not be joking about it. They may want to find out what is our reaction towards them sharing their thoughts. So better be safe than sorry. Really ask them seriously if they have the thought.
There is a question from Aida. What should we do if we want to help a loved one, but we are also struggling ourselves?
Yeah. So if we are struggling ourselves, do you think what we are discussing today would apply to you? I mean, like we could seek help. We can seek support from people around us. We could seek professional help. We could do self-care activities. So it goes back to helping yourself to get help by seeking professional support. Yeah.
So I can see that time allocated for Q&A is almost running out. So we'll have one last question. How to know if their suicidal ideation is for real or just for attention seeking?
I think it goes back because as a friend or a family member, we are not professionals. So we want to be safe than be sorry. So, okay, another fact is that when people are talking about suicidal ideation, it's not about attention seeking, it's a cry of help. So they are so distressed that they are giving out signals that I need help. So again, better be safe than sorry, and encourage them to seek professional help and also give them support. Vashini, I think we have time's up, right?
Yes. Thank you everyone for your questions, and thank you Ms. Lee Kaishin for answering them. I'll pass the floor on to you.
Okay, so we are going to continue to our part 2 of the workshop, where we are going to breakout rooms and we'll watch a video and discuss about it. Hajar, do you mind opening up the breakout rooms for us? So we will be going into different breakout rooms.
All right, breakout rooms.
Challenges with mental health and suicide are not uncommon. Many young people feel depressed, stressed, or pressured by what's happening in their lives. Not knowing how to cope, they become overwhelmed. challenges with mental health and suicide are not uncommon. Many young people feel depressed, stressed, or pressured by what's happening in their lives. Not knowing how to cope, they become overwhelmed. For many, these powerful feelings of helplessness and hopelessness can lead to thoughts of suicide because they don't see any other way out of their problem. The right help from friends, family, faculty, and others, leading them to professional help when necessary, can not only rekindle hope for those in despair, but can also change the course of their lives. It can be life-saving help. Our goal today is to empower you with mental health first aid, tools, and strategies to help those who are suffering. This video will educate you on the key warning signs of mental health distress and suicidal behavior. It will also provide tips on how to initiate the right conversation, often one of the most difficult steps in supporting someone. With these simple tools, you will be better prepared to really help. To set the scene for you, Amber and Mike are good friends of Jamie. Mike has been noticing a number of changes in Jamie's behavior over the last few weeks. These changes worry his friend Mike.
And they scored a 5th goal in the last minute. Our guys couldn't stop them at all. It was pretty embarrassing.
That sucks.
Yeah, without Jamie, it's gonna be rough this season.
What do you mean, without Jamie?
I heard he quit the team. Just stopped showing up for practice. I guess someone on the team found him in his dorm room and he said he just didn't want to play anymore.
You gotta be joking. Jamie.
Honestly, I'm really not too sure. It's too bad though. They'll miss him. He's always one of our best playmakers. Hey, there he is now. Why don't you just ask him?
Jamie! Jay, aren't you talking to us? Hey guys. Amber was just saying that you quit the hockey team. What's up?
Just don't feel like playing anymore.
You love hockey.
Yeah, you're one of the best players on the team.
Yeah. Too late. Gave away my gear already.
You gave away your gear? What's going on? I never see you at meals anymore. Not even in class. Even when you do show up, it's like you're not there. You're spaced out. What's going on?
Nothing is going on.
You got a new girlfriend. That's it, isn't it?
It doesn't sound like nothing. I'm worried. The last couple of weeks, it's like I don't know you. I'm just worried.
Nothing to worry about. Just stuff.
Stuff? Like what? Come on, Jay. We are worried about you.
Hey, Mike, leave the guy alone. You'll be fine in a few days, won't you, Jamie?
Don't worry about it. It's nothing. Nothing will help anyway.
What do you mean nothing will help? What's going on, Jamie? Talk to me, man.
I told you. Nothing. Nothing is happening. Just leave it alone. I'll deal with it.
Told you. Girl troubles.
Amber. I can't leave it alone, man. Now, tell me, us, what has got you so down? Maybe we can help.
Just tired, Mike. Tired of it all. It's not gonna change. I told you guys. I'll deal with it.
Tired of it all? I'm not so sure you can deal with this by yourself. Please, let us help you.
Leave me alone. I don't want help.
I'm concerned. I'm scared even. In all the time that I've known you, I've never seen you like this. I've got to ask, Jamie. Have you considered suicide?
What?
Suicide? Come on, he's not that stupid. You would never do that, would you, Jamie?
It isn't about being stupid. It's about feeling hopeless and so down that the things that used to matter stop mattering. So, no, this isn't stupid, Amber. He's missing classes, skipping meals, not hanging with friends, giving away his stuff, quitting hockey. That's what it is. Jamie, isn't it? You're feeling hopeless and thinking that things will never change, so what's the point? Jay, is that how you feel?
Mike, what are you talking about?
Well, sometimes.
Come on, Jamie, not you.
Anyone can think about suicide. Anyone. Even the strongest of people can feel overwhelmed sometimes and think that suicide is the only way out. That's it, isn't it?
I've always been so good at everything. Everybody expects me to be the best. The best at school, the best at sports, the best. And I'm exhausted. I can't deal with the pressure anymore. Honestly, I can't even think straight anymore. When I study, I read the same page over and over again, and I can't remember what I just read. Can't seem to get out of bed sometimes. I barely have the energy to get on my gear, let alone play hockey anymore. Let everybody down. Just a big disappointment to everybody.
So, you have been thinking about suicide.
Jamie, like Mike said, we're worried. And we're here for you.
Have you thought about how you would do it?
Well, when I drink, sometimes I think about getting really drunk and driving really fast down the highway into a truck or off a bridge or something.
But you hardly drink.
Have you tried doing that?
No, just thought about how easy it would be.
Have you attempted suicide any other time?
No. I thought about it once, a long time ago. I don't remember why, though.
Jamie, this sounds serious. We want to help.
Jamie, the feelings that you have of hopelessness, the exhaustion, the suicidal thoughts, there is help. People do get help, get well, and things do get better. The fact that you're telling us how you're feeling shows that you don't want to die. Now, have you told anyone else how you're feeling?
No. No. No one. And you guys have to promise me that you won't tell anybody either.
Sure, Jamie, we won't.
No, we can't make that kind of promise. I'd rather have you mad at me than have you dead.
Dead?
Dead. If we don't get you some help, that's how you might end up. No way am I not doing something.
He's right, Jamie. You're too important to us. We can't think of you killing yourself. You'd do the same for us, right? Jay, let us help you. Please.
All right.
Good. How about if we talk to your parents?
God, no. But maybe I could talk to Coach. Unless he's still pissed at me. I can trust him.
Let's go see him now.
I don't know. Can we go tomorrow?
What about if we saw him now? The sooner we go get help, the better.
Yeah, we can go with you to the health services office tomorrow. And in the meantime, you can call one of those helplines or crisis lines, whatever they're called. Posters outside the library.
I don't know about that.
That's okay. One step at a time. We'll go see your coach now, and if you need it, later tonight, we can call Kids Help Phone. It's not just for kids. It's for people our age too. I learned that in my mental health first aid training. They have 24/7 counselors, and it's all confidential. Like Am said, their posters are all around.
We'll write down the numbers on the way to see your coach, and if you need to talk to someone who knows more about suicide, and you can't get a hold of one of us, you can call one of them.
Yeah? I didn't know I could call someone to get help. I guess we could do that.
Now, Has drinking been part of your plan to cope?
I guess.
I learned in my course that when people are thinking about suicide, any drugs or alcohol can sometimes make them act on those thoughts. So let's be smart. I'll give you a drive if you need a lift.
Might make sense, Jamie.
Okay. I promise I won't drink. And yeah, we can call the helpline.
Great. So just to make sure we're good, repeat to us what you have just agreed to.
Yeah, I know. It's part of the drill, right? Okay, let's see. We'll go talk to Coach. And while we're waiting to talk to him, I'll call the 24-hour helpline. I'll get the number and the health services number. Mike, you'll drive me back to Res in my car. And if I need to talk to somebody tonight, I'll call one of you guys or the 24-hour line. Oh yeah, I forgot. Do I need to call my parents too?
That would be a great idea.
I think my mom has picked up on my mood, but my dad has no clue. Maybe she can help me tell him. Oh, and I promise I won't drink until I'm feeling better, right?
Good.
So, let's go see your coach.
Let's go.
I never see you at meals anymore. Not even in class. Even when you do show up, it's like you're not there. You're spaced out. What's going on?
Sometimes I think about getting really drunk and driving really fast down the highway into a truck or off a bridge or something.
Feelings that you have of hopelessness, the exhaustion, the suicidal thoughts. There is help. People do get help, get well, and things do get better. We'll go see your coach now, and if you need it, later tonight, we can call Kids Help Phone. It's not just for kids, it's for people our age too. When people are thinking about suicide, any drugs or alcohol can sometimes make them act on those thoughts. So let's be smart.
Challenges with mental health and suicide are not uncommon. Many young people feel depressed, stressed, or pressured by what's happening in their lives. Not knowing how to cope, they become overwhelmed. For many, these powerful feelings of helplessness and hopelessness can lead to thoughts of suicide because they don't see any other way out of their problem. The right help from friends, family, faculty, and others, leading them to professional help when necessary, can not only rekindle hope for those in despair, but can also change the course of their lives. It can be life-saving help. Our goal today is to empower you with mental health first aid tools and strategies to help those who are suffering. This video will educate you on the key warning signs of mental health distress and suicidal behavior. It will also provide tips on how to initiate the right conversation, often one of the most difficult steps in supporting someone. With these simple tools, you will be better prepared to really help. To set the scene for you, Amber and Mike are good friends of Jamie. Mike has been noticing a number of changes in Jamie's behavior over the last few weeks. These changes worry his friend Mike.
All right. So seems like everyone is returning from their breakout rooms. So to wrap up for my session, I would say a very, very important thing is to take care of yourself, prioritize self-care, because if you support someone in psychological distress, it's very tiring. So very important thing is to take some self-care after you have support someone, because only when you take care of yourself, you can take care of others. Yeah, that's all from me. Thank you everyone for joining and participating.
Thank you, Ms. Lee Kaishan and Ms. Varshini Tanabalan for enlightening us on how to support someone who is experiencing distress. Sometimes it can be quite challenging for us to understand how we could be of support to this person and how we could be there for them. And as Ms. Lee Kaishan had mentioned, it's very important for us to take care of ourselves before we take care of others. We hope that the audience was able to gain valuable information to practice this with their loved ones.
Thank you. Welcome, Ms. Madiha Fuad. Good afternoon. Thanks for joining here today. We'll start in a bit. But before that, now we will present the winners for Instagram Reels competition category 2, which is the Family Matters, where participants have shared with us what family means to them. Let's take a look at the Reels.
Ya Allah, stresnya aku. Kerja banyak. Aku minta tolong member-member tak ada. Benda aku nak buat ni. Macam aku seorang. If only ada macam family ke yang boleh tolong. Dah.
Sorry again, everyone. There's some technical difficulties. We'll be right back.
was first diagnosed with a certain mental health condition, I was struggling helplessly that I felt like I was drowning in the middle of the ocean that was the deepest. And while I was going through that, people perceived me as someone who was a strong swimmer, who could beat the waves by my own. Well, maybe I am. Maybe I have the power. But I get exhausted to the point that I could only lie and pray that the sea will not claim me on that day. But there's this little boat that I could cling on. It seemed like an eternity before my hand found something solid, and I held on tightly to that capsized boat. I was still under the water and my lungs ached for air, and just when it seemed like they would burst, I emerged above the water. It was sheer relief to breathe in the cool, sweet air, and never before had I realized that the air was so sweet and soothing, and the boat here that I meant was my family.
Congratulations to all the winners, and thank you to all who participated in this competition. If you did not win, please do not be disheartened, as your reels have brought smiles and laughter to the viewers. What could be more valuable than that? Ladies and gentlemen, now let us move on to the second and final webinar of the day. Our next speaker is Ms. Madiha Fuad, the founder of Plus Vibes, an all-in-all solutions provider for mental health and well-being. Ms. Madiha graduated with an MBA and a high achievement scholarship, as well as PhD in business with 100% scholarship. She was an investments relations director, as well as a business journalist for The Edge. Ms. Madiha is also the founder of various businesses such as Marcella, Maddie's Cafe, and Juicier Juicery Food Truck. Ms. Madiha has very kindly agreed to attend our mini symposium and give a talk on pandemic and access to the mental health services. Let us now warmly welcome Ms. Madiha to share her insights on this topic.
Hello, everyone. Thank you so much for inviting me. I'm honored. I hope this will be a really good session for everyone. First of all, I loved that video just now. I loved watching it. I got goosebumps watching it. And I want to say congratulations to the winners, but those who don't win, Plus Vibes is also hosting a Breaking the Stigmas challenge. So it's exactly the videos that you guys posted there. So just tag us on Instagram, My Plus Vibes, and we will be rewarding you guys with our Plus Vibes self-care kit, which is like essential oils, diffusers, because actually this is like really good. Awareness is number one. And I would love to share your videos on our platform as well, so other people can get a survival guide. That's the most important thing. So basically, because of World Mental Health Day, our focus is actually addressing the silent pain. What you guys did was you guys addressed that silent pain, and you guys really shared how you guys got through small tips like doing karaoke in the car, doing video calls with your friends, all those small tips. Actually, sometimes when you're really struggling, you don't really think about it. So I hope that by us sharing your videos as well, I hope it will help a lot of people too. That's first things first. Second, let's go on to the presentation and how you guys can get access to mental health assistance. Okay. So topic for today is the pandemic and the access to mental health services. So I saw a video just now, right? Where someone was just like, I don't know how to reach out for help, right? I have friends, maybe you have a support system, you have family, but sometimes you can't really open up in terms of your struggles or your challenges, and you might feel much embarrassed or shy, and you don't want people to judge you. And we tend to have this perception that the closest people we know will tend to judge us. So what other mental health services are there so that we can get that kind of help, right? Next slide. Okay, first of all, I would love to know how you guys are feeling. Type in the chat box whether you guys feel energized, demotivated, burnt out, blessed, excited, lonely. I think a lot of people feel lonely, social isolation. Just type it up. You guys are excited because this is a good event. Okay, what else is there? Anything that you want me to focus on specifically? Okay, definitely burnout but happy. I'm feeling the best in a very long time, alive and ready to rumble. Wow, I'm feeling good. Good Sunday. see, because of this talk that you guys organize, see, it really does allow people to really think about their mental health, provide them opportunities to learn from one another, and that's so important. So I really hope that that you guys keep on doing these kind of events. Let's spread awareness and allow different types of access to mental health for people who are silently struggling. Okay, next slide. First of all, mental health statistics in countries, in 130 countries. First things first is that, according to studies from WHO, people have struggled to get mental health assistance because of the pandemic. So traditionally, mental health services are counseling, right? You have to go to mental health clinics. You have to call hotlines. They're very traditional methods. So when the pandemic hit, people who require consultations, to see psychiatrists for their medications, they get stopped and they can't reach that access. So what happens? People become stuck at home and they become so lonely and so depressed that we see cases in suicide, right? I think suicide cases this year and last year have spiked up. Depression and anxiety is not a new thing. Actually, before the pandemic, there were 4.7 million working adults who reported mental health issues, but nothing was really done about it, right? But because of this pandemic, everything spiked because now we see suicide cases. We see a lot of people speaking up, which is really good. So it helps those who were also previously struggling. But the thing is, with this pandemic, people can't really go out and reach for that help, that assistance that they need. So you can see here at school, mental health services have been disrupted, at work also, and then there's disruption to counseling, and then critical harm reduction services has also reduced. See, so how do people get help during this pandemic when you really don't know what kind of platforms there are, right? Okay, next slide. The impact of the pandemic on mental health. So as you can see, previously, there were already those who were suffering with mental health issues because of work stress, childcare stress, relationship, financial. There are so many different categories that can affect you, but these are all life challenges. Now, because of the pandemic, because of the social isolation, we can't really seek out for help. So what do? It has caused 59% reported depressive symptoms, and all of these are spiked up. You've got anxiety symptoms, you've got symptoms of stress. So what happens when you keep all those emotions and all those struggles inside? It will reach to a level where you just completely explode. And then that's where we have these suicide cases. We have students, we have lawyers even. It's not, mental health doesn't discriminate in terms of age or in terms of occupation. It affects everyone. Whether you're a student, whether you're a working adult, and whether you've reached the highest part of your career, it affects everyone. So the pandemic has really amplified this and resulted in everyone to really suffer silently. Next slide. So there are, though, positive effects and negative effects. So actually, it's just how we perceive the situation. It's all about our mindset. We will always face challenges in life. There will be that ups and downs, that chapter where you have good chapters, and then there's a stressful chapter. But this stressful chapter, if you have a positive mindset, actually, you can learn something from it. So you can see here, there's positive effects and negative effects, right? If we're looking at negative effects, you can see that parents with children less than 18 years old have been living at home. They reported worse mental health as a result of the COVID-19 pandemic. Why? Because sometimes they're not used to it. So even on Plus Vibes, right? Plus Vibes is basically a mental health solution provider. We have a mobile application, data analytics, and workshop. What happens is that we collect data, anonymous data, on chat usage. So what happens is that we got this 13-year-old student, teenager. She was on the mobile application and she was saying, my mental health is really suffering because I have issues with my parents. What do I do? See, so these are negative effects where parents can be a bit too strict on their children to an extent where the children feel overpressured, right? In terms of grades, you've got probably doing house chores, you've got things that they want you to do. So unnecessary impact because everyone is under one roof for a long period of time. You can't go out. So these are negative effects. But if you look at it from the positive point of view, what happens here is that it encourages family connection. You have more time at home. So for example, you have a lot of siblings, you're living under one roof, but everyone's working or everyone's going to study in different campuses, right? You rarely see one another, right? So actually you can shift that into having a positive mindset where, hey, we only have probably a few months, 3 months lockdown. Let's make the most of this. Let's do like activities together. What did you guys learn in your university, or how's your work? That kind of discussion, which rarely happens on a normal day-to-day basis. So again, this, you can look at it from a negative point of view or a positive point of view, right? Okay, second, job security or financial stability, which is affecting a lot of people nowadays. Negative effects, of course, losing your job brings feelings of uncertainty, insecurity, and then you have all that financial instability. How do you, if you have a certain life standard, for example, you need to buy food, you need to buy children, necessities, how do you cope in that kind of situation where you lost your job? Of course, you would feel a lot of pressure here, and perhaps sometimes you can't even speak to your spouse. So again, on the users on the app, we get a lot of people not complaining, but they're so demotivated. They don't know where to reach out for help. When your spouse doesn't understand, you don't want people to worry. For example, your parents, if you're working and you're still living with your parents, and then your parents are like, hey, how's it going? Did you lose your job? And you don't know what to say, right? So how do you open up to your parents without making them feel worried? So job security and financial stability really does affect people negatively, but there's also a positive effect to it. It's all your mindset. Perhaps if you lost your job, there are opportunities for you to become freelancers. There's the new economy for gig workers, where you can actually pitch your skills, do part-time jobs, and you can get a lot of different types of jobs. A lot of the youth nowadays are moving towards that. They're no longer going towards permanent positions in companies. Instead, they want the flexibility in terms of time, the ability to choose what kind of jobs they want. They have the flexibility of working with different types of team members, because in a permanent position, you would be stuck in a certain team. And even if you don't like your boss or team, you would still have to face that because that's your job, and that can cause stress. So the positive effect of perhaps if you lost your job or if you were retrenched are new job opportunities, new time to learn new skills. So for example, previously you were an accounting student, but actually you didn't like accounting because maybe your parents asked you to do accounting. What you wanted to do was marketing. So this was your time to really learn about marketing, develop new skills, technology, everything you can learn online. So again, two different sides. Job security and financial stability, you can look at it negatively, where you can feel down, you can feel like, okay, what am I going to do? I have no job. You can have that kind of mindset, or you can look at it as an opportunity to pivot in your life, to learn new skills, to try new industries, right? Because it doesn't mean that you have only one path. There's always that different chapter. So now it's a different chapter, okay? Third, personal psychological disturbance, okay? So here, negative effects. Of course, there's fear of anxiety, there's fear, there's social isolation because of COVID. Sometimes you will get paranoid when someone's coughing around you and you're going out to the supermarket and they're not wearing a mask. So you feel that kind of paranoia. This is very normal. In the working world also, where people are working from office nowadays, you will see that kind of paranoia where everyone's disinfecting, and you create that kind of tension with your team members and colleagues. But that's the negative side of it. If you look at it from a positive side, there are things where there are digital health solutions on various applications, Plus Vibes is one of it. You can look at this as a phase where this is temporary. COVID pandemic, I'm talking about the intense lockdown, yeah? I think COVID will be with us for years, even for decades. It's just another flu, but we will have to learn to adapt to it. Just like we learned to adapt to all the other diseases and global diseases that happened before, right? So again, effects caused by this pandemic, there are negative effects, but there are also positive effects. So you just have to change your mindset to look at it on a positive point of view. Next slide. Okay, why should mental health services be available, especially for the youth? I think there were close to 1,700 suicide cases from 2019 to 2021. And do you know how many youth there were who committed suicide? It was 870. Those were the youth. So more than half of it were actually the youth who committed suicide. So why is that? It's because of that kind of pressure where they probably have financial constraint. Getting access to counseling during the pandemic is difficult. And again, online therapy, 1 hour will cost you maybe 100, 200, 300. Youth don't have access to that kind of financial flexibility. So young adults are more likely to be affected by mental health issues. Why is this important? Why should mental health be accessible to students? Because, of course, it will improve a student's academic performance, not only academic, but also in terms of your work life, your ability to be productive, to be happy in learning whatever industry you're learning in, right? So this is very important. The second is support your mental well-being. And basically, this is just your happiness. In this world, it's not just about working. It's about being happy in what you do, what you're learning, your journey, your path, how you're growing, and it's all about your happiness. So when you have a strong mental health, when you have a strong mindset, that determines your level of happiness. You won't be as easily affected to all the small mishaps in life. You'll understand that, okay, life challenges, everybody has life challenges. How am I going to learn from this? How am I going to pivot from this? That's the mindset that we should have if our mental health is strong. Third, suicide prevention. Again, as I said earlier, there were close to 800 over suicide cases committed by the youth. And this is very sad because the youth are our future workforce. They will be the person who will be building this nation. So if they are not mentally strong, if we don't help them build that strong mindset, what will happen to the future workforce? What will happen to the divorce rate, the mortality rate, the nation's GDP? So that's why there's such an importance on stressing how mental health is important for the youth as well. And that's why we definitely encourage youth to have these kind of events, to have these kind of awareness talks where we can all learn from one another. Last but not least, increase student retention, because there have been student dropouts because of mental health issues. The thing about students who are studying in the university is that they're afraid to open up about their mental health issues because they're afraid people might judge them. They're afraid maybe the lecturers might be like, oh, are you capable of studying? Are you mentally capable of studying? So they don't want to open up. So in the end, they just drop out. They just drop out and they'd be like, it's okay, I'm just gonna wait until I get through this phase. But then again, how are you supposed to get out of that cave if you don't ask for advice or help or ask someone how to help you? Because again, someone else's survival guide can help you. We learn from one another, and that's why history is also very important, right? So increase student retention. To increase student retention, mental health services for the youth is very, very, very important. Okay, next slide. So how did the pandemic shift mental health accessibility for the students? Well, I think there are a lot now, university organized mental health services. This is one of it, which is that awareness, where we can provide this kind of platform. Counselors, psychologists, industry partners can share their opinion on mental health. This will provide students an insight to this, but there are also university organized mental health services such as those chatting with a buddy. I think a lot of universities do that nowadays. I think IUMW is one of it, where they have someone for you to talk to. I think it's a really good support system where you can have someone who is your colleague or team member. But the most important thing is that it has to be anonymous. So again, there are also platforms such as Plus Vibes where you can chat anonymously to a therapist, counselor, listener. And the most important thing is that we want to encourage that kind of activity where people reach out for help. It should no longer be where you keep everything inside and then you feel like you don't have access to help and then you just suffer silently and alone. It shouldn't be that anymore. Right now, it's all about opening up. Okay, you identify that you do have a problem or a hiccup in life, but you should always look for help. Okay, next slide. Okay, in general, how can the public have access to mental health services. So there are 3 different types. For the public, you can, of course, browse through the internet, there's social media. There are different types of things where there's assessments, there's quizzes, there's modules. All of these kind of things are available on the internet. You can look at different types of social media pages. I think my favorite one, which I think you guys all follow, is Dr. Julie Smith. She gives really good insights on, and she does it through reels, which is very engaging, especially for me, the youth, and anyone. It's very bite-sized kind of knowledge where you can learn about mental health awareness, things to do if you're feeling burnt out, and small things. So social media can be used also to create that kind of mental health awareness. Second, you also have your counselor, your university clinics. Students do have special privileges to obtain this mental health care. You just have to try. I know sometimes if you do have a problem and this is your first time trying to speak out, you will feel like a bit nervous, a bit embarrassed, but you should remember that the effects of you holding it in, although you think you can, but it will eat you up inside. It will go to a point where you will be like this, and then you can't take it anymore. So why? Why would you want to bottle that up inside when actually talking it out to a counselor, your university mental health buddy, anyone will actually help you. Why? Because you know journaling, right? Journaling actually allows you to reframe your thoughts. When you put all your struggles and ideas on paper, you're actually restructuring your thoughts. You're thinking like, okay, I clearly have a problem here. And my next problem is this. So what am I actually struggling with here? Oh, okay, I identify, okay. I'll give an example. Family issues. Parents, okay, I'm struggling with my parents who don't understand me. They're always asking me to do house chores and they're pressuring me, but I have university work. I have assignments where I'm struggling with my group members because everything's digital. See, so all of this unnecessary stress will actually affect your mental health and your ability to sleep. And then you start having insomnia, you start overthinking. So again, if you write it out, if you talk it out, it's actually you reframing your thoughts. That's why talking it out, seeking for help is very important. I know a lot of people who are like afraid to speak up, right? They're like, I've never done it before. I'm afraid. How do I start? I mean, I'm giving examples from people on the app. So actually they're like, okay, I'm chatting here. What do? Do I just share my problems? Yes, that's basically it. You just talk. I think it's the cultural stigma where we just keep everything inside. We're afraid to talk. But there's always small steps to everything. We all start from zero. We have to just slowly open up. And then once you really open up, you will feel so much more comfortable. You'll have a better perception in terms of how to handle your problems. Okay, and last but not least, it's employees at the workplace. So employers can actually help you where you have HR services. I think we have a lot of corporate companies on board Plus Vibes. Why? Because corporate companies will then outsource an individual mental health solutions provider to help the employees. So what we do is our services are completely anonymous. So then we will know, okay, this department has financial issues. This department has childcare issues. So we can clearly create a solution, a workshop for these specific departments. The thing about these outsourced services is that it's completely anonymous. So it's not your HR team or your colleague won't find out about your problems. I think that's what refrains people from seeking help. But then again, if you don't seek out for help, you will reach that stage where you'll get burnt out, you'll feel demotivated, you'll feel tired, and you'll feel that no one cares. And we want to change this, right? Okay, next slide. Okay, general access to mental health services. So I hope you guys take a picture of this or screenshot this. If you need hotlines, there is Befrienders, Talian Kasih. There are people who you can talk to if you feel comfortable talking. For physical appointments, there are UKM, there's MIASA, there's MMHA, and there's also all of these places you can book an appointment. You can talk to a counselor, psychiatrist. The point is that you always have to reach out for help. You can't keep it in, okay? So if you're comfortable talking, call the hotlines. If you'd like a physical appointment, you feel like you want to talk to someone, there are these Association and NGOs. MIASA is an NGO, MMH is an NGO. And last but not least, there's also Plus Vibes. So you can scan here. We're available on the Apple Store and the Google Play Store. Don't worry, all the chats are completely anonymous and they're completely free as well. What we're doing at Plus Vibes is that we're providing that kind of platform where people can reach out for help regardless of their occupation or financial status. So the point is to create a mentally resilient society. And the first step is to get that strong mindset, to get that kind of advice, to get you through your challenges in life. So please try out any one of these mental health supports. Call, see someone, or just chat therapy. Try out whatever makes you feel good. There is no one solution that fits all. You just have to try out different types of things. Who knows, some of the things will work, and then maybe some of it you would need to go for a physical appointment, or maybe you will start off by doing chat therapy first, sharing your small problems first. So there is a lot of different types of methods. Okay, so screenshot this. Okay, next slide. So I talked all about mental health solutions, all that kind of stuff. Now I'll talk a little bit about Plus Vibes, our vision. What we plan to do is that basically we plan to transform the mental health solution. So currently it's all very traditional, right? You have to go to a clinic, you have a hotline. What we want to do is we want to transform this traditional mental health solutions with positive vibes. That's why our name is Plus Vibes. See? So what we want to do is we want to create a digital platform where people can look for motivation, relaxation activities. You can talk to someone anonymously. So that access is available 24/7 only on your phone. So you can take it anywhere, whether you're about to sleep, whether you're at work, you're in class, whenever you feel like you're having a breakdown, you can get that 24/7 support. So far, our acceptance rate, it only takes 2 minutes. So if you guys download, you can try, talk to someone. Within 2 minutes, hopefully you will get someone who will be able to listen to your problem. And I think that's the most important thing. Next slide. Okay, so our features, just in general, yep, you can click that video, what it looks like. It's on the Apple Store and the Google Play Store. There's the Wheel of Life, where you'll have to rate on a scale of 1 to 10 how happy you are in certain categories of your life, right? And then the lowest one, below 5, it will give you articles and videos for you to learn. So here there's personalized journey, where you can talk to someone. It's a direct link where you can just talk to someone, where there's health, childcare, relationship, stress, financial. We also list out all of the mental health services, NGOs that are available in Malaysia. So it's just direct access to help if you need it. For example, there's mental health clinics also on there. And then here's a journey where every week we'll change different types of topics. For example, this week we'll put a journey for learning about anxiety. Next week, maybe it's about nutrition. The week after, it's about maybe short exercises that you can do. You know, just really bite-sized information that you can do to develop yourself. Rather than you going to Google and typing things one by one, or going to YouTube and then searching and then be like, no, this video is not cool, next one, you know? So it's just easier for us to just put everything in a platform and then really have that kind of one app where you can just reach out for help. I'll share with you how I developed this actually. You must be thinking like, wait a minute, you started off doing food truck and then you did cafe and then you did interior, you did a lot of different types of things. So how did you suddenly do a mental health application? Well, I was in my last semester of my PhD last year. I was doing it at Taylor's University. I was doing business. So imagine doing PhD, it requires a lot of research and effort and a lot of time where you're sitting on the computer. And that will affect your positioning if you don't stretch, you don't move around. So technically, this kind of position in long hours, and I'm talking about 12 hours straight, just typing, you know, PhD is like close to 400 pages. So then that kind of thing really affected my body. What happened was I was diagnosed with a long thoracic nerve damage on my back. And it caused my scapula to become like this. See, so it became like this and it stuck out and I couldn't move my arm. So imagine from running different types of businesses and then suddenly being stuck with a nerve damage and I couldn't move my arm, I couldn't do anything. So I went from like trying to climb up in terms of my career and I just crashed. I was just like I can't do anything. I'm embarrassed to go outside. How am I supposed to look for help? I felt I would say that was the most life-changing event for me, right? So what happened then was that I couldn't reach out for help, right? I couldn't go out to see that traditional type of mental health solutions, which was a counselor or a psychologist, psychiatrist. I couldn't do that. So I was stuck at home. So then me and my friends, of course, doing business together, we're thinking like, how about we create something where you can reach out for help just like that on your phone? You don't have to go out, right? Because that would solve my problem too. And I'm sure there will be so many other people who will have this kind of situation too. It doesn't necessarily mean you will have a physical limitation like me, but you might have, perhaps you're embarrassed, or perhaps you can't have access to that kind of mental health clinic, or perhaps you have financial constraints. There are different types of problems we all face, right? So then we're thinking like, okay, chatting is one of it. The second thing, what was it that I needed? Okay, I needed breathing exercises, because when you're in constant pain, I was on painkillers and all these kind of medications, it was causing a chemical imbalance in my body. So I kept on having anxiety and panic attacks. It was really bad, and I didn't know how to control this. And every time I would go to YouTube, and I keep on having to open like physiotherapy or breathing exercises, you know, and it became really troublesome for me to go to my computer to open this. And it wasn't really a comfortable situation where I had to sit on my chair again. So then we put all of those videos on the mobile app, all that relaxation activities, that motivational articles, the thing that actually lifts up your mood. So when before I go to sleep or whatever, things where you're thinking like, oh, okay, I'm overthinking about certain things, you can just browse positive vibes, you know, that's the main point. And that's why we wanted to create this kind of system where we're spreading positive vibes, right? Okay, next slide. So how far have we gotten so far? We have 10,000 public users. Our average chat rating is 4.7 out of 5, but of course in any technology, I mean, we're only 1 year old, you know, since last year. But we're constantly developing the app. I think there are a lot of things to learn. So for me, it's about being agile. Developing an application is something completely out of my area. So I've had to learn a lot. There are still a lot of bugs, things we want to fix on the app. But we're growing slowly. I think the main point is that we want to give that kind of access to the public. We've partnered with a lot of universities. We hope that we can do something with UOC as well, really just to create that kind of mental health awareness, accessibility for all students. Because mental health shouldn't really be a luxury for people who can afford it anymore. It should actually be a necessity for everyone's well-being, because again, this will be the future workforce, this will be the future generation, and that's what we have to build and take care of. Okay, last slide. And that's about it. Let's be friends, let's keep in touch. Let me know if you have any questions or things that you want to ask, things we should improve on. Of course, we're not perfect, we're still also developing, we're only 1 year old, but I would love to know your thoughts, and yeah, keep in touch. Oh, and for that the videos earlier, please do tag us. We want to give our self-care product line for free to you guys. Actually, the reason why we're doing it is because we just launched it, the essential oils, diffusers, all these kind of things. So we have like a self-care product line. So we're gonna have like relaxation tea. So we want to give that all for free so that you guys can develop a positive self-care habit. Thank you, guys.
Thank you, Ms. Madiha. I think it's like you said, mental health should not be a luxury anymore. It should be a necessity for everyone, where everyone can reach out whenever needed. Thank you so much for your speech. And now we're actually going to open the floor for a Q&A session for 10 minutes. So kindly use the chat box to post your questions. And for those who are watching us live from YouTube, feel free to type in your questions in the chat box there. And then we'll pass it on to Ms. Madiha.
Thank you, Ms. Madiha, for your valuable sharing. We got our first question. Our first question is from Ping. Hi, Ms. Madiha. May I know how can entrepreneurs help the public in accessing mental health services, especially the undeserved communities, even with getting a phone?
Yeah, true. I think that's the thing that a lot of people should focus on, especially entrepreneurs. I'd like to categorize myself myself as a social entrepreneur because we're focusing on mental health. In terms of getting a phone, I think they're starting that phase where they're giving out laptops for people to study digitally with all this kind of digital transformation where people are starting to learn online. I think there are access to a lot of free laptops. I mean, I think I heard on the radio, they are also doing competitions where they can give students or give people free laptops. I hope one day they will also do the giving access to phone as well. In terms of entrepreneurs, the best thing that we can do is develop the system for people to have that kind of mental health services. That's what we're doing at Plus Vibes. Hopefully, we'll be able to stabilize and grow the company so that we can provide different types of access. So it's not just about talking to someone in terms of counselor. Perhaps it can even be to an extent where we can have group anonymous AA meetings or group meetings where people can talk about, for example, drug addiction or struggles or whatever, but it's anonymous. Right? So I think there are a lot of things that we want to plan to do in the future. Entrepreneurs can help develop that system. But again, it has to be really supported by government, corporate companies, and everyone. We really have to work together to change this kind of mental health stigma and provide access to everyone. Yeah.
Thank you, Ms. Madiha. We have our second question from Wafi. Wafi, you can unmute yourself and ask the question.
Okay, thank you, Sanjida. Hi, Miss Maria. I just would like to know, how do you stay positive at the times when things are not turning on your way, you know, when things are like going the other way? How do you stay positive at that time?
Yeah, good question, Wafi. So that question really resonates with me. I mean, I told you, right? I had a nerve damage last year. I was going down that cave and it was so hard. It was so hard for me to get out of that cave. And I was constantly having this kind of panic attacks and things. And I was thinking, what can I do? The thing is, you always have to understand that everything happens for a reason. If you can really accept that, if you can truly accept that, then you'll have a positive mindset to it. Because then you'll think like, okay, this happened to me. What did I do? I built a mobile application out of what happened to me. You see? So that was really like a 360 transformation. And it's not just me. You can do it too. Anyone can do it. It's all about your mindset. It's all about what do you want to achieve. You have to be strong enough to see that everything happens for a reason. Okay, this chapter, you're faced with this kind of challenges. What is it that you want to achieve? What is it that you want to learn from it? How can you grow from the situation? Everything happens for a reason. And I think that's the thing that we really have to accept.
Thank you, Ms. Nadia. And yeah, if let's see where do I go after this? Let's say if I get a mental breakdown, where do I reach out? You know, when I don't feel like going out, like you, I just feel like giving in. And things are not going my way and I feel like giving in. How do I reach out? Like just the positive vibe, the plus vibe is a good method, yeah?
Yes, you have to always try to reach out for help. I know I know a lot of people, when they feel demotivated, stressed, they don't really want to go out. They just feel like staying at home in their comfort zone. But the thing is, you can't stay stuck there. If you stay stuck there and you don't move out of that cave, you'll always be there. So how are you supposed to pick yourself up? You need to expose yourself to different types of people. Talk to different types of people. Call the hotlines. Chat with Plus Vibes. You have to open up. Or if you don't want to talk to people, write down your ideas. Write down what it is that you're struggling. Again, I talked about journaling, right? If you don't feel like talking to other people, you're struggling, write it down. Write down what you're struggling with, and then identify what are the main areas of concern, and then how you can improve, what you can do. If you can't think about how you can get out of that zone, talk to someone. Another way is that find a hobby. Find a good hobby that you like to get you out of that zone. For example, cycling. I think a lot of people do gardening, small things that you can actually build your skills or learn new things, right? It takes your mind off that stress.
Exactly. Because currently working out is my only hobby right now. And that's the only thing that gets me out of that situation, you know.
So working out. Now, working out, it's not just working out, it's building that working out. So for example, what kind of body do you want? What are you focusing on? Your arms, your abs, take
Going
it
through that, right?
See, take it that kind of mindset. It's not just simply just working out. It's reaching an end goal. So when you know you have an end goal, and regardless of whatever you're doing, this hobby, if, for example, working out, you're reaching an end goal, you have a motivation to reach there. You will slowly push yourself to reach there, and you will leave the past behind.
Yep. Thank you so much for that. But it's a real eye-opener. I'm happy and joined this event. Thank you, Ms. Madhya. The next question.
Okay, thank you, Wafi, for the question. Thank you, Ms. Madiha. For our third question, it's from Raf. Ms. Madiha, may I know how to stay positive when the people in my own group is looking down or talking bad about me?
That's a tough one. And I think a lot of students struggle with this. How do you stay positive when the people in your own roof is looking down and talking bad about me? I think I've seen a lot of cases where students and the youth face this. The people under your own roof, I'm assuming it's your family, it's your friends, that probably demotivating you. Then again, it's very, very hard, because you know why you get so affected by what they say is because you feel that they're your support system. You have so much care towards them. So everything that they say, you will take it personally and you will become very sensitive about it. But again, it's all about your mindset. Perhaps when they look down on you, you have to just spin that and be like, okay, don't worry. You say that I can't do it? Watch me prove it. That kind of mindset. Because again, when I was young, believe it or not, I was not smart. I was a slow learner, and it was so difficult for me to get into schools. I have 5 siblings, so I had to actually tumpang them and be like, okay, you got into school, I'm going to go in that school too, because my grades were so bad. And then you would have people be like, you're never gonna succeed. Your grades are so bad. What are you gonna become? You have people who will say like that. But then what you can do is always be like, yeah, okay, maybe I'm a slow learner, but then again, I will start to improve. I will prove you wrong. Have that kind of mindset, because people will say whatever they want to say, and you really can't control what they want to say, whether it's your friends, your families, people who don't know you. You even see on social media where a lot of these celebrities just get bashed by doing what they want to do. So people will always say negative things, but perhaps it's just their personality. Perhaps it's just how they express themselves. What you can do is take that point and be like, okay, I'm going to prove you wrong. I'm going to work on it. I'm going to show you in maybe 1 year's time, I'm going to succeed or do this kind of things, or just understand that people have different perceptions. So just be strong. Take it as a point for you to build on. I think there's a quote where, all the people who throw stones at you, in the end, you build an empire with it. You don't let it hit you. You just build that kind of wall and just build an empire with it. So take all those stones and build that empire, and then, invite them over.
Thank you, Ms. Madiha. Our next question is from Chut Putri. Hi, Ms. Madiha. As a person leading a team for a huge initiative, how do you mind your own mental health while taking care about your team members?
That is a very good question. So again, today I have been back to back with talks. I started from 9:30 to 12 p.m. Then I have 2 to 3, and I actually have another one 3 o'clock. So in like 3 minutes, 3 until 3:30, and then another one 4:30 until 5 until 9 p.m. So you imagine, how am I going to handle my mental health? Again, the thing is, I love what I'm doing. I love sharing different types of knowledges. I love sharing my experience. I'm very passionate about what I'm doing. If you focus on what you're passionate in, you don't mind working 24/7, or you don't mind putting in that kind of effort. The only reason why people feel stressed is because they're not happy with what they're doing. They feel like maybe this is not really my passion. I don't really like the people I'm with. It doesn't really matter about the people, actually. It's about what you're doing. If you love what you're doing, doesn't really matter. You will just keep doing it and you'll feel happy doing it. Like for me, all the reviews that I read on Plus Vibes and then doing these kind of talks, seeing how it helps a lot of people, just the small things that I can contribute, that makes me happy. That's how I take care of my mental health. It's by feeding my mind with positivity that I'm contributing in helping other people. So regardless if I'm tired, in the end, I get a good night's sleep because of that. So in what you're doing, whatever that you're doing, think about how you're contributing to other people. I think I read this thing about how for an entrepreneur to become really sustainable in what they do, and in the company that they're building, what they have to do is contribute to the society. And that's the most important thing. That will actually result in you being happy, regardless if you're working 24/7, you'll still feel motivated to work. Why? Because you feel like you're really creating an impact. And I think that's a lot what the youth want to do. The youth want to really change things. They want to contribute what their skills are. They want to become different things. We don't really want to stay in our comfort zone anymore. We want to try out different things. So for you guys should do that. Focus on something you're really passionate in. And your mental health will always be taken care of. If you're looking for stress, then try something that you don't like. Then you are leading yourself to that stress. Okay?
Thank you, Miss Madiha. We are actually running out of time. Can we take one more question? One last question?
Okay. Sure, of course.
Okay, Miss Madiha, this is from Nur Zulaikha Kamaluddin. I would like to ask how to actually seek help about social anxiety, which was something that didn't occur to me before the pandemic, and to boost confidence and self-esteem, which worsen in this pandemic.
Yeah, social anxiety is something that a lot of people face nowadays because we've been 2 years in this kind of pandemic, lockdown, not lockdown kind of phase. And then you have that and you have that social anxiety where you're afraid you might get COVID. You've seen so many people being affected by COVID. I think the best thing that you can do is to reach out for professional help. What you can do, you can talk about it. Again, for anxiety, if you are keeping it up inside, then you will constantly trigger that anxiety. When you want to go out, you'll be overthinking. Anxiety is caused by you overthinking about the future, about things that will happen. Depression is all about the past, right? So social anxiety is about what will happen if this happens. If I go out, will I get COVID? I haven't been interacting with people socially in 2 years. What do I do? All of this can, inshallah, be solved if you talk about it, if you meet a professional, if you call a hotline. That kind of comforting word can calm you down, can give you a new perspective. Again, reading is another good thing where you can keep on educating yourself. Why is this important? Is because the knowledge that we know right now is just here, right? If we don't read or talk to someone, we can't really get new ideas, new perspective, new knowledge. So again, talking to someone, getting different perspective, reading about social anxiety and things that you can do will help you in one way or another. It won't help you completely, but it is a first step. And again, everything is about taking that first step.
Thank you, Ms. Madiha, for your time and the effort in sharing your experiences, your story, your motivation, and hopefully the story is a driving force for us to motivate us to take our downfalls and create into something much more beautiful. And thank you all for the questions. And once again, thank you, Ms. Madiha, for your time and your effort.
Thank you, everyone. Keep in touch. Bye.
Bye.
We are almost at the end of our event. Before we end our symposium, we would like to invite Ms. Lim Yong Shin, clinical psychologist trainee, the chairperson of the WMHAD Mini Symposium 2021. Let's welcome Ms. Lim Yong Shin for her closing speech.
Thank you to our lovely MCs and good afternoon to everyone. So it's been a pleasure to be with all of you today. The Mental Health Awareness Day, Bridging the Gap mini symposium is organized to educate the public on the inequalities in accessing to mental health services and to provide the strategies that could be taken to bridge the gap. With everyone's contribution, this mini symposium has successfully included 4 different types of workshops, which teach about relaxation techniques, assertive communication skills, time management skills, listening skills, so that you can provide support to someone who are in need. There are 2 webinars with invited speakers. The first webinar was led by Ms. Anum Sophia from Thrive Well, which talked about the mental health situation in Malaysia and community mental health services that could help to build up the resilience in the community when mental health services are not really accessible. Then the second webinar, which was conducted by Ms. Madiha Fuad, which discussed about mental health access during this pandemic and how this pandemic has positively and negatively affected everyone's mental health. And also she suggested many various types of solutions to the public so that we have more solutions instead of just being stuck at one place. Lastly, we also organized 2 Instagram Reels competition to promote the awareness on self-care and connecting with family. We hope that you enjoyed the mini symposium, the workshops, the Instagram Reels, and apologies for the technical difficulties and lag in between the events. I would like to start by thanking the program coordinator of the Master of Clinical Psychology, University of Cyberjaya, Ms. Marquez Pari Karunanidhi, for suggesting to organize this event. Besides that, we also like to thank Ms. Loheswari Arumugam for giving us invaluable advice in the process of organizing this event. We are very grateful for the general sponsor by Tabung Amanah Zakat, UOC, Psyche Club, and Arena Oasis, without whom this event would not have happened. I would also like to provide my gratitude to my team. We together as a 4th batch clinical psychology students. Thank you to the vice chairperson of this event, Ms. Hang Ping Shin, the program team, the workshop instructors, the moderators, the facilitators, the publicity team, logistic team, and the MCs. Your commitment made this wonderful event a reality. It all started from the planning and the first meeting until today, the actual event has taken place. So thank you for everyone for going for the extra mile. Your dedication and effort in organizing these events are truly appreciated. I would also like to thank Psyche Club for obtaining the funding, the promoting the event, and providing us a lot of manpower. A special thanks to Ms. Chut Putri for being patient with us. Your attention to detail made this organizing process a smooth journey. The collaboration with the Psyche Club has been such a pleasure as we receive a lot of guidance and support during the planning and organizing. Furthermore, we would also like to thank the Peer Wellness Club for providing us the manpower, facilitators, and volunteers that supported the running of this mini symposium. Thank you again for being here with us today. I hope that after participating in this event, you will start to notice the inequalities in accessing to mental health services. And possibly you will take the first step in being part of the movement to bridge the gap in accessing mental health support. There are many external factors like the pandemic, the systemic obstacles, or the current economic situation, or a lot of other things that we cannot control. But we can change ourselves, our own choices, so that we can lead a life that's worth living. With that, I would like to end my speech with a quote by Jimmy Dean. You can't change the direction of the wind, but you can adjust your sails to reach your destination. Take care and have a good day, everyone. Thank you very much. Bye-bye.
Thank you, Ms. Youngzing, for your closing speech and for your dedicated hard work in organizing today's event.
Ladies and gentlemen, thank you all for joining us today. Hope all of you had lots of fun and were able to take back valuable information that would be of use. We hope that everyone has been inspired by the sharing from our wonderful speakers and has gained valuable insights on how to help to bridge the inequalities in mental health services in Malaysia.
Kindly scan the QR code of the feedback form or use the link that has been posted in the chat box to share your thoughts on this event and to also receive a certificate of participation.
Finally, we would like to end this event with a photo as remembrance. If you are comfortable with turning on the camera, please turn it on and let's take a picture. Let's have 30 seconds for everyone to get ready. Please maintain your pose or smile as we may need to go to different pages to take the picture.
All right, let's take a picture now. Everyone kindly turn on your cameras. We'll wait for 30 seconds.
All right, guys. Okay, now we are taking picture of first page. 1, 2, 3. We now move on to the second page. 1, 2, 3. And third page. 1, 2, 3. And the last page. 1, 2, 3. All right. Thank you, everyone.
Thank you, Shijo. All right, once again, a kind reminder, participants kindly remember to fill in the feedback form that has been posted in the chat box or using the QR code in your screen. On behalf of the planning committee, we would like to thank everyone who has directly or indirectly contributed to the success of today's event. To the planning committee who has been working ceaselessly for the last 3 months to make this event possible, your hard work will never be forgotten.
Thank you, everyone, and have a great day ahead.
Thank you, everyone. See you all soon.